Item 20, AB 931. Item 21, AB 952, and Item 31, ACR 62. And we'll open up the roll for a vote on the consent calendar once we have a quorum. Today's testimony will be 2 witnesses in support and 2 witnesses in opposition, 2 minutes each. This will be strictly adhered to in this committee today. And without further ado, we're going to start as a subcommittee. Assemblyman Beal, please come on up. Oh, no, Mr. Chesbro. I still call you Senator. Senator Chesbro, please present.
Hopefully this is not a controversial bill and I can get on to my other committees. AB 1445 will allow federally qualified health centers and rural health clinics to be reimbursed by Medi-Cal for a behavioral health visit that occurs on the same day as a medical visit. Currently, Medi-Cal does not reimburse for a patient to see a primary care provider and a behavioral health specialist on the same day. Only one visit is reimbursable in this situation. Federal law permits reimbursement for same-day medical and behavioral visits and provides federal matching funds for states that choose to allow same-day visits. California, however, has not taken advantage of those federal funds. Unfortunately, Medi-Cal's reimbursement policy has created a barrier to providing 2 visits on the same day, despite it being cost-effective and drawing federal funds, as well as being the best way to ensure patients receive the care that they need in a timely fashion. As for the cost issue, rate recalculation amendments were taken in the Assembly Appropriations Committee to address the fiscal issue and make the bill cost-neutral. There's no opposition to the bill, supported by numerous organizations, and I would strongly urge your vote.
Witnesses support.
Good afternoon, Senators. Lori Johnson with the California Primary Care Association. We are the sponsor of AB 1445. I'm here to answer any of your questions that you may have, and I urge an aye vote. Thank you.
Charlotte Newhart with the Directors of Maternal, Child, and Adolescent Health in the county. Strong support.
Thank you.
Julian Voris with the Urban Counties Caucus and strong support.
Donna Seitz representing Los Angeles County Board of Supervisors in support.
Farrah McDade-Ting with the California State Association of Counties in support of the bill.
Thank you. I understand there's no opposition. And questions from members?
Mr. Chairman, I will move the bill when we have a quorum.
Great. We'll move the bill when we have a quorum.
Thank you, Mr. Chair and members.
Thank you, Mr. Chesbro. Assemblyman Bell. You have 3 items, Assemblyman. Would you like to start with file item 5, AB 217?
Correct. Thank you, Mr. Chairman. AB 217 is a bill that deals with screening and brief intervention. This bill allows counties to provide the state match in order to draw down available federal funds for screening and brief intervention for pregnant women and women of childbearing age. Prenatal exposure to alcohol, tobacco, and other drugs can severely damage the development, structure, and functioning of the fetal brain. As a result, fetal alcohol syndrome is one of the leading known preventable causes of birth defects and developmental disabilities. About 1 in 12 women nationwide reported consuming alcohol, and about 1 in 12 pregnant women consume alcohol, and 1 in 30 pregnant women said they had engaged in binge drinking, according to the U.S. Center for Disease Control. Effective prevention, intervention, and screening can reduce this needless suffering while significantly reducing long-term health care costs. However, despite the evidence of their benefits, screening and brief interventions have not been widely used in primary care settings, emergency rooms, and state licensed facilities and clinics. A new federal rule change allows California to receive federal revenue to perform screening brief intervention services, making them more affordable. This bill will help prevent fetal alcohol syndrome, the #1 cause of babies born with developmental disabilities. And we have some testimony. I urge your vote on this.
Witnesses in support.
Shannon Smith Crowley, representing the American College of Obstetricians and Gynecologists for California. We find universal screening and brief intervention to be extremely successful, even without further treatment. Of course, further treatment is helpful, but even just informing women as to what is that no alcohol or substances are safe during pregnancy actually is amazingly effective.
Thank you.
Charlotte Newhart with the Directors of Maternal, Child, and Adolescent Health in strong support.
Thank you.
Stephen Mulhart, representing the California Association of Alcohol and Drug Program Executives in support.
Thank you.
David Ford, California Medical Association, in support.
Thank you.
Farrah McDade Ting with the California State Association of Counties, in support.
Thank you. Any witnesses in opposition? Questions from the members? Assemblyman, we don't have a quorum yet, but this bill will be moved when we have a quorum.
Thank you.
Would you like to go to file item 7, AB 303? What's your wish?
Why don't we do 417?
Okay. File item 10, AB 417.
417, I'm sort of waiting for
Understand.
303. Senator Alquist is the principal co-author. I don't know if she'll be here, but 417. AB 417 is a bill related to buprenorphine. This would add buprenorphine to the Medi-Cal formulary for addiction of opiates. I would agree to various of the technical amendments and the amendment to address the department's concern regarding a physician who is not under the department's oversight and does not work under the license of a NTP, which is a non-cited primary care clinic. The misuse of drugs such as OxyContin is more effectively managed by buprenorphine than methadone. And buprenorphine is a safer option in comparison to other treatments because there is less potential for abuse and less risk of risk diversion. Buprenorphine has also been approved for the use of young adults, age 16 and over, in a population where prescription drugs abuse is increasing. As I like to point out, methadone is not allowed for young children or adolescents. Private sector health care and insurance plans authorize the coverage of buprenorphine as appropriate, successful, and effective treatment. California added buprenorphine to the formulary for Medi-Cal in office-based settings. However, the Department of Drug and Alcohol Programs has never authorized a reimbursement code for buprenorphine therapy in its drug and Medi-Cal program. The unavailability of the therapy in drug Medi-Cal has created a two-tiered system of treatment for drug and alcohol problems. In practice, providers do not have the access to the most advanced medications and therapies for tuning opiates. Adding buprenorphine to drug Medi-Cal program has been recommended by our legislative analyst office because it would give treatment programs the ability to customize treatments to the need of the individual. And it's supported by the California Narcotic Officers Association, the California Medical Association, Drug Policy Alliance, and we have witnesses.
Witness support?
Mr. Vice Chair, members of the committee, Robert Harris on behalf of the California Society of Addiction Medicine, California's addiction medicine specialists. We think this is a very important bill. We would like it to go farther, but despite that fact, the fact that you can make this really safe drug available to more people, to help more people, to get them in treatment at a younger age, is critical to improving the treatment system in California, and therefore we're in support of this bill.
Mr. Chairman, members, Donna Brownsey, representing the California Opioid Maintenance Providers. While we agree with most of what Mr. Bell said in support of this bill, we do support the bill. One of the applications that's very important is for about 10% of the opioid-addicted population, methadone does not work. It's not a good drug for them. So having buprenorphine available for that purpose is very important. Right now, it's although this won't be potentially covered in the drug Medi-Cal formulary because a specific rate won't be developed, we still think it's very important to have that as part of the pharmacopoeia to treat these patients. So we would urge your aye vote. Thank you.
Other witness support, identification purposes?
Stephen Mulhart, representing the California Association of Alcohol and Drug Program Executives. I'm also an executive at Aegis Medical Systems. We were part of the NIDA clinical trials on buprenorphine. We believe in this drug. We think it's important to have it included in this formulary.
Thank you.
David Ford, California Medical Association, in support.
Mr. Chairman, Randall Hager with the California Psychiatric Association. We're in support.
Okay. Any witness opposition? Senator Cox?
Mr. Bell, I want to support this bill today. I'm wondering if you would consider a 5-year sunset with a report back to the committee as to how the program was working. You know, we put these programs in, and they seem to always stay in place. And to the extent that we're adding a new program, I wonder if you would be agreeable to a 5-year sunset with a report back to this committee as to the efficacy of the addition here, as well as the cost and all that kind of stuff.
I don't particularly have any problem with that.
Okay.
No.
You'll accept that as an
I'll
author's
accept that as
amendment
an
then?
author's amendment.
Mr. Chair,
Mr. Leno.
I recognize the chair's agreement to that. I think that it is something new we're doing here. It's not uncommon for us to do a sunset, so we can come back and review. Sure. Just be careful in the way we write that amendment so that it doesn't become a poison pill in appropriations, because sometimes a report can do just that.
All right. Fine. I don't have any objection to being certain that it's not a poison pill.
I'm trying to be reasonable. I think it's worth looking at, because I think what it'll show is you'll be able to take care of kids, you know, under 18. It'll be cost effective. We already know it's cost effective. So I think it will save a lot of money and provide better treatment, and I think that's what it'll show.
And we also need clarification who's going to do the report.
So that might be DADP.
Right.
But again, they need to be able to recognize they can do it within their existing budget.
Okay.
All right.
So we'll move as amended when we have a full committee. Assemblyman, would you like to go to file item 7, AB 303?
Yeah, this is okay. Senator Alquist is a principal co-author of this. And this bill, AB 303, would allow public and private hospitals to access federal supplemental reimbursements for their debt service for their projects related to seismic retrofitting. The state's inability to supply funds to access federal monies or match the federal monies available for seismic safety construction requires that we work with this innovative approach to finance the construction of seismic retrofit of our hospitals, and I ask for aye vote.
Witnesses in support?
Good afternoon. I'm Michael Skehan. I'm the Executive Director for Santa Clara Valley Medical Center in San Jose. VMC is Santa Clara County's public hospital, and the county is proud to be the sponsor, or to be a sponsor of AB 303. As you know, the late Senator Al Alquist authored legislation to ensure hospitals are ready to withstand and remain operational during California's next major earthquake. VMC is eager to make structural changes to our facilities so we can continue to provide healthcare services, particularly during a natural disaster. Hospitals like ours lack funding for these improvements, and due to county budget shortfalls, public hospitals face even greater hurdles. In Santa Clara County, last year, our residents supported a $750 million bond measure to pay for the first phase of our seismic project and prevent the closure of hospital beds. Even with this assistance, we still need an additional $500 million to complete the project. Many other hospitals are in the same position. That is why maximizing available federal funding is so important. AB 303 would allow public hospitals to utilize the Certified Public Expenditure, or CPE, mechanism to draw down federal matching funds for expenses related to hospital seismic compliance. This mechanism is only available to public hospitals. It is a unique opportunity before us, and AB 303 would allow us to maximize the potential. I want to thank Assemblymember Bell for his leadership on this issue. AB 303 will help keep California's safety net operational at the time it is most needed. Thank you for your time and attention. I respectfully request your aye vote on this important issue.
Further witness support?
Beth Capel on behalf of the Service Employees International Union. We represent some of the workers at this hospital, as we do at many other public hospitals across California, including San Francisco General as well as Los Angeles County. I want to note that the prior program, the 1732 program, was something that had bipartisan support, being signed into law by then Governor Duke Majan. It allowed many but not all of our county hospitals to rebuild by drawing down additional federal funds. This would simply reinstate that program, and probably we should never have let it lapse while we still had county hospitals that had not yet met their seismic obligation. So we think that this is an important measure for those hospitals that we all rely on.
Nicole Wortelman on behalf of the City and County of San Francisco. This particular measure will help San Francisco General Hospital draw down federal funding, and we appreciate Assemblyman Bell's introduction of it.
Thank you. Any witnesses opposition? Questions from members? The bill will be moved as soon as we get a quorum.
Thank you.
Assemblyman, thank you so much.
Thank you, Mr. Chairman.
Assemblywoman Yamada? Did I pronounce that right? Thank you, Assemblywoman. Which item would you like to start off with?
I'd be happy to start with AB 369.
Okay, that's file item 9,
approval.
members.
Thank you very much, Mr. Chairman and members. I am presenting AB 369, which would allow for 2 adult day health centers to be exempted from the current California state moratorium that was in effect since 2004. These 2 adult day health centers are co-located with veterans facilities in Lancaster and Ventura, which are a little bit outside my district, but would go to serve people in the military who have gone all over the world in service on our behalf. This measure has had strong bipartisan support. You may note in the analysis that the floor vote was 78-0, although the Assembly Appropriations vote was 14-3, I believe it was. There was new information that came to light subsequent to the Assembly Appropriations vote that allowed for a nearly unanimous vote on the floor of the Assembly. I have with me Jennifer Gabales with the California Association of Adult Day Services and others in support of the bill. I respectfully request your aye vote.
Thank you. Witnesses in support.
Good afternoon. I'm Jennifer Gabales with the California Association for Adult Day Services. We are sponsoring this bill. These 2 veteran-focused ADHCs were funded by California bond money and federal grants. We believe their inability to become certified for Medi-Cal payment is an unintended consequence of the ADHC moratorium that has been in effect for several years. And I'm here to answer any questions that you may have.
Further witness support? Right. Thank you. Any witness opposition? Questions from members? Assemblywoman, I'll move the bill when we have a full quorum and a full committee.
Thank you very much.
Would you like to move forward to file item 16,
I
AB
would indeed.
710?
Thank you so much. I am
Thank you.
presenting now AB 710, which is also a veterans bill. This bill would require that the California Department of Veterans Affairs work closely with the California Department of Mental Health to address a burgeoning problem of mental health issues amongst returning veterans, particularly from the war on global terrorism, but others as well, with particular interest for women in combat who, for the first time, are coming home, serving side by side, and are experiencing very high levels of military sexual trauma, which leads to PTSD, post-traumatic stress disorder. I would like to thank the committee, staff in particular, for assisting us in drafting an amendment, which we are happy to accept, and also would recognize the California Department of Veterans Affairs. I don't know if they're here at the moment, but they did have an opposed position at our previous hearing, and I hope with this amendment that they would be willing to go forward with us. I do have a number of witnesses in support and ask for your aye vote.
Witnesses in support.
I'm Carla Dave Ting with the California State Association of Counties in support of the bill.
Cindy Hillary, Regional Council of Rural Counties in support.
Brandon Tartaglia with Disability Rights California in support.
Dana Nickel with Pete Conantine Associates, representing the American Legion, AMVETS, and the Vietnam Veterans of America in support.
Assemblywoman, for clarification, I just want to make sure that we're talking about the same amendments, that the committee amendments that are under number 2, under comments.
I believe that is correct. I have
Okay.
a copy here. Initially, we had requested that the Department of Veterans Affairs apply directly for SAMHSA grant funding, and now we're asking that they work closely with Department of Alcohol, Drug Programs, and Mental Health.
That's great. Thank
Yes,
you. Thank you,
that is
Assemblywoman.
correct. Thank you.
Senator Leno.
Thank you, Mr. Chair. This question may have already been answered, but escaped me. Do we know why the department has not already applied for the grants?
Yes, actually, despite this bill coming forward last year as well, there is a federal rule that requires single state agencies to be recipients of certain kinds of grant monies. That extends to discretionary funding as well. So despite all good intentions, this bill in a similar form came forward and went through about 8 or 9 committee hearings, 2 ledge council reviews, and so forth. And we were able, thanks to the assistance of the staff of this committee, as well as the department, we're able to find out that this rule applies in this case. So we do strongly urge the Department of Veterans Affairs, however, to work in this area in conjunction with Department of Mental Health and Alcohol and Drug Abuse, so that we can focus in on the very specific and unique needs of returning veterans' mental health issues.
Well, I'm glad you're addressing this. I think one of our nation's great shames is the way we ignore the mental health needs of returning veterans. We see the rates of suicide even before they're released from their service, and then the devastation of lives due to post-traumatic stress disorders and the ravages of war. And so I would be very pleased to join you, since we're amending the bill, as a co-author.
Thank you. Thank you very much, Senator.
Any witness opposition? No? Okay. Assemblywoman will move that bill. I'll move the bill as soon as we get a quorum. We'll put it up for a vote.
Thank you. I appreciate your support, and let's keep working on all these issues together.
Thank you, Assemblywoman. Assemblyman Nava from the great city of Santa Barbara.
Mr. Chair, it's a pleasure to be before my senator, Chair and Senators. I'm here to present Assembly Bill 359, digital mammograms. According to the California Cancer Registry, among women, breast cancer is the most commonly diagnosed cancer and the second most common cause of cancer death. Accordingly, the registry estimated that in 2008, more than 21,000 California women would be diagnosed with primary breast cancer and 4,200 women would die. Currently, the California Department of Public Health reimburses providers for breast cancer screening under the Every Woman Counts program done by analog mammography only. However, mammography providers are increasingly converting their equipment to digital, leaving large areas of the state without an analog provider. That means that women in some areas must travel over 2 hours to obtain their mammogram. In our district alone, approximately 2,248 women in the Santa Maria, Lompoc, San Luis Obispo region are impacted by the lack of access to digital mammography. This bill will rectify the situation by requiring coverage of digital mammography screening when analog mammography services are not available from an Every Woman Counts provider. This bill permits the Department of Public Health to reimburse a provider for digital mammography only if the provider agrees to receive reimbursement at the analog rate. Would ask for, at the appropriate time, ask for an aye vote.
Assemblyman, are you planning on taking the amendments? I'm sorry, the
Yes.
amendments. Okay, thank you. As authors amendments.
So, Mr. Chair and members, Monica Miller on behalf of the County of Santa Barbara, and we're the sponsor of this legislation. As the Assembly member said, you know, women in our county in particular drive up to 2 hours to get their mammography, and the reality is they're not going to do it. And we have several providers within the county, the Tri-County region, I should say, that are willing to do this on a voluntary basis. They actually approached our public health department, and we've heard from the Department of Public Health statewide that there are other providers that are interested in doing this. So there's no additional cost to the state. Again, it's on a voluntary basis. And there's also a sunset in there because we realize that this is a temporary fix. We don't see this at all as a long-term fix, but right now the state fiscally obviously cannot catch up with the technology, but we do need to try and capture these women and save their lives. So we urge an aye vote. Thank you.
Further witness support.
Mr. Chair and members, Bob Ackerman with the California Radiological Society. Radiologists obviously are the physicians who provide these screening mammography services, which is essential to this program and the effort. Women need to be screened, but please bear in mind the solution of this bill is basically for providers to get half of what Medi-Cal pays for the same service. This equipment is much more expensive. The sponsor and author are absolutely right. The equipment is being replaced. Digital is going to be the standard, the norm in California. But the solution of the bill is to pay basically half of what Medi-Cal pays for a similar service. That is not sustainable. So this program needs to be funded adequately to make sure that women are effectively screened.
Other support witnesses for identification purposes?
Nicole Wertelman on behalf of the City and County of San Francisco in support.
Thank you.
Shannon Smith Crowley, American College of Obstetricians and Gynecologists for California in support.
Thank you. Any witness opposition? Any questions from the members? Assemblyman, I'll move the bill. I move the bill when we have a full quorum.
Thank you, Mr. Chair and Senators. Thank you.
Now we have our wonderful chairwoman. Here we go.
What's the quorum?
We have a quorum, so let's call for the...
Senator Alquist?
Here.
Alquist here. Strickland?
Here.
Strickland here. Honested? Cedillo? Cox?
Here.
Cox here. DeSaulnier? Leno?
Here.
Leno here. Maldonado? Negretti McLeod? Negretti McLeod here. Pavley? Pavley here. Woke. We have 6.
We have 6. We have a quorum.
Madam Chair,
Yes.
may we then take item number 1445 for Mr. Chesborough? It was the first bill we heard. I would move move that bill.
Yes, let's do that.
Item
All right.
number 26.
Yes, thank you, Senator Cox. So we'll take up for a vote file item 26, AB 1445 by Assemblyman Chesbrough.
Senator Alquist?
Aye.
Alquist, aye. Strickland?
Aye.
Strickland, aye. Honested? Cedillo? Cox?
Aye.
Cox, aye. DeSaulnier? Leno?
Aye.
Leno, aye. Maldonado? Negretti McLeod? AB 1445?
And we will, how many votes?
Pavley? Pavley, aye. Woke? It's got 5.
That bill has 5 votes. We're going to put all the bills on call because a lot of our members, including myself, have been off presenting bills over in the Assembly.
Madam Chair, I'd like to move the consent calendar.
That would be fine. Let's take up the other bills first. And since we started with 26, let's just go in reverse order. So we'll do file item 16 and go backwards.
I'd like to move the bill.
Thank you, Vice Chair Strickland. This is file item 16, AB 710, Assemblywoman Yamada.
Senator Alquist?
Aye.
Alquist, aye. Strickland?
Aye.
Strickland, aye. Honested? Cedillo? Cox?
Aye.
Cox, aye. DeSaulnier? Leno?
Aye.
Leno, aye. Maldonado? Negretti McLeod? Negretti McLeod, aye. Pavley? Pavley, aye. Woke? It's got 6 votes.
That bill has 6 votes, which is enough to get out, but we are going to put all the bills on call. Next, going in reverse order, would be file item 10, AB 417 by Assemblyman Bell.
Move the bill. As amended.
As amended.
The bill has been moved as amended.
Senator Alquist?
Aye.
Alquist, aye. Strickland?
Aye.
Strickland, aye. Honested? Cedillo? Cox?
Aye.
Cox, aye. DeSaulnier? Leno?
Aye.
Leno, aye. Maldonado? Negretti McLeod? Negretti McLeod, aye. Pavley? Pavley, aye. Woke? It's got 6.
That bill has 6 votes, and we will keep it on call. That was
Next one's 9.
okay.
I need a motion.
Need a motion for file item 9, AB.
Senator Strickland said he'd move it when we got it.
We have. Oh, okay.
Was there amendments on that?
No amendments.
No, just move the bill.
So Senator Strickland has moved file item 9, AB 369 by Assemblywoman Yamada.
Senator Alquist?
Aye.
Alquist, aye. Strickland?
Aye.
Strickland, aye. Honested? Cedillo? Cox?
Aye.
Cox, aye. DeSaulnier? Leno?
Aye.
Leno, aye. Maldonado? Negretti McLeod? Negretti McLeod, aye. Pavley? Pavley, aye. Woke? It's got 6.
That bill has 6 votes. We will keep it on call also. File item 8, AB 359 by Assemblyman Nava.
Move as amended.
Move as amended with Senator Strickland. Thank you.
Senator Alquist?
Aye.
Alquist, aye. Strickland?
Aye.
Strickland, aye. Honested? Cedillo? Cox?
Aye.
Cox, aye. DeSaulnier? Leno?
Aye.
Leno, aye. Maldonado? Negretti McLeod? Negretti McLeod, aye. Pavley? Pavley, aye. Woke? It's got 6.
6 votes, and we will keep it on call. File item 7, AB 303 by Assemblyman Bell.
And Senator Pavley said she would.
And there's a motion by Senator Pavley. Is that correct? Thank you.
Senator Alquist?
Aye.
Alquist, aye. Strickland?
Aye.
Strickland, aye. Honested? Cedillo? Cox.
Aye.
Cox, I. DeSagne. Leno.
Aye.
Leno, I. Maldonado. Negretti McLeod. Negretti McLeod, I. Pavley. Pavley, I. Woke. It's got 6.
Thank you. That has 6 votes, and we will keep it on call. Next, we have file item 5, AB 217 by Assemblyman Bell. It's been moved by Senator Strickland.
Senator Alquist.
Aye.
Alquist, I. Strickland.
Aye.
Strickland, I. Honested. Cedillo. Cox.
Aye.
Cox,
Aye.
I. DeSagne. Leno.
Aye.
Leno, I. Maldonado. Negretti McLeod. Negretti McLeod, I. Pavley. Pavley, I. Woke. It's got 6.
Okay, that bill has 6 votes, and we will keep it on call. There are 5 bills members proposed for consent, and we've already said what they are. Okay, so it's been moved by Senator Strickland, Vice Chair.
Senator Alquist.
Aye.
Alquist, I. Strickland.
Aye.
Strickland, I. Honested. Cedillo. Cox.
Aye.
Cox, I. DeSagne. Leno. Leno, I. Maldonado. Negretti McLeod. Negretti McLeod, I. Pavley. Pavley, I. Woke. It's got 6.
That bill has 6 votes, and we will keep it on call. Thank you, members. I see that Mr. Huffman's here, Assemblyman Huffman. File item 12, AB 523. Welcome.
Good afternoon.
Good afternoon.
Madam Chair and Senators, let me begin by accepting the technical amendments and on page 8 of the analysis, and also thanking the committee staff and the Chair for working with us so well. This bill provides a 2-year extension to current seismic safety retrofit deadlines for Marin General Hospital. And let me just say at the outset, Senator Alquist, that I do this with the highest respect for the pioneering work that you and your late husband have done on these important seismic deadlines. But I think for the reasons that we're about to discuss, it will be clear that we have a unique situation that deserves some very narrowly tailored special treatment. And this bill has been narrowly tailored to respond only to the unique situation in Marin County. Marin General Hospital is currently operated under a lease agreement with Sutter Health, but it will transition back to the Marin Healthcare District in 2010. So having assumed responsibility for the structural upgrades and retrofitting necessary to meet the seismic requirements, the healthcare district now faces an extremely short deadline for completing the entire process of approving architectural designs, conducting environmental and safety studies, and completing construction. This bill provides that the healthcare district will have an extension for 2 years to meet these standards. It will preserve important interim deadlines, and it will apply only to Marin General. But perhaps the most significant safeguard that we've included is that it doesn't apply at all unless the hospital actually transitions from Sutter back to the healthcare district. It's important to note that Marin General Hospital is an essential safety net hospital for the region. In fact, it's the only provider of emergency trauma care in Marin County. This bill recognizes the unique challenges facing the hospital and its critical importance to the community, and I respectfully request your aye vote.
Thank you. As Vice Chair Strickland probably mentioned to you, we are limiting testimony to 2 witnesses, 2 minutes each.
Thank you,
In
Senator.
support and when there is opposition.
Senator Jim Randlett, representing Marin Healthcare District. We are the sponsors of this bill. I would just say a couple things in addition to what Mr. Huffman has said. One is that the extension given in this bill is the same period as the extension given in Senator Cox's bill, so we're not going beyond what other hospitals have received. And the second thing I would mention is because healthcare districts are special districts, to provide the funding for rebuilding this hospital will require a vote of the people. And this makes it, of course, very difficult for the time frame that's involved, so that the 2-year extension is vital if this is to get on the ballot and receive a vote of the approval of the people to approve. In many healthcare districts in California, the population has been very supportive. El Camino, Washington, Alameda, several other healthcare districts have voted the 2/3 vote requirement for these bonds to rebuild their hospitals. We would respectfully request an aye vote.
Thank you.
Jim Gross on behalf of the County of Marin. This hospital is essential to the services to both trauma patients and the needy in the county. The county has pledged $20 million toward the seismic upgrades, and this bill will enable us to ensure that that does indeed occur, and we ask for your aye vote.
Thank you.
Beth Capel on behalf of the Service Employees International Union. We are not in support of this measure, but neither are we opposed. And we appreciate very much the work of the author and of the hospital district in trying to craft this narrowly. As the author and the district have indicated, they find themselves in a difficult situation because of the ownership transition, and we respect that it's an important hospital. We also respect that it's a hospital that's within sight of the San Andreas Fault and that they are committed to getting it rebuilt and having it be safe.
Thank you. Opposition? Is there opposition? The bill has been moved by Senator Strickland, and Senator Leno has a comment?
Yes, I do. I want to reiterate but not repeat the comments of Assemblyman Huffman that this is indeed a unique situation given this divorce that's occurring between Sutter and the hospital. And not only is it the only trauma center in the county, it's also the only mental health, inpatient mental health and obstetrics provider.
And maternity. My two children were born.
Yes. And that the vast majority of indigent and Medi-Cal patients in the county are also served there. So this is an extraordinarily important facility, and I'm very confident that the district will be able to follow through on its commitments within this 2-year period. Given that you are taking amendments, with your blessing, I'd like to be joined as your principal co-author.
Very glad to do that, and thank you for your support.
You bet. And thank you for your authorship.
I'd like to make a brief comment. First of all, I'd like to thank Assemblyman Huffman and his staff for working very closely with our committee staff and with me. I really appreciate that. I think the bill has really been crafted in a way that it's very narrow and focused, and I certainly understand the problem. I just want to communicate to my committee members, and how can I say this? The bill probably needs to get out, but I just need not to vote because as the Senate's representative to the Seismic Safety Commission, I just feel that we're going to have 1,000 bills in the next 2 minutes if I just don't want to send that kind of message. I think for very unusual cases like this one is, I think this is a dire situation that we do need to deal with it. So with that, the bill has been moved. Are there any more comments? Has been moved, so we've had a motion.
Senator Alquist?
Not voting.
Strickland? Aye. Strickland, aye. Honested? Cedillo? Cox? Aye. Cox, aye. DeSaulnier? Leno?
Aye.
Leno, aye. Maldonado? Negretti McLeod? Negretti McLeod, aye. Pavley? Pavley, aye. Woke.
That bill has 5 votes. In order to get out, it will need 1 more, and in addition to that, we are just keeping all the bills on call.
Thank you very much.
Okay, thank you. Is he? File item 11, AB. It's file.
He's got 4 items.
Okay. Assemblyman Delatorre, who has 4 items, and we will begin with file item 2, AB2. Welcome. Of course. Of course. So, where's...
I apologize for that.
Assemblyman Delatorre has offered to Assemblyman Davis to go first.
Okay,
and so we will go to file item 27, AB 1457. Welcome.
Thank you very much, Chairwoman and distinguished members of the Health Committee here in the Senate. I present to you AB 1457, which will require each licensee of a skilled nursing facility to disclose with each abbreviated contract of admission and contract that they are contract with each resident, the name of the owner and the leasee for the facility, and the name and the contract information of a single entity that is fully accountable for all aspects of patient care and the operation of that particular facility. In fact, what has occurred is that many of the residents for these facilities have complained that they did not have the appropriate information of who owns the facility. And so this bill will require that attached there to the contract will be that pertinent information as to who the individuals who own the facility are in case they have some problems that need to be resolved. I basically respectfully ask for your aye vote on the measure.
Thank you very much. Those in support? Opposition?
I move the bill.
The bill has been moved by Senator Leno. Any comments or questions from committee members? Let's call for the vote then. Let's catch your plane.
Thank you.
Senator Alquist.
Aye.
Alquist, aye. Strickland.
Aye.
Strickland, aye. Onnested. Cedillo. Cox. Aye. Cox, aye. DeSaulnier. Leno.
Aye.
Leno, aye. Maldonado. Negretti McLeod. Negretti McLeod, aye. Pavley. Pavley, aye. Woke. It's got 6.
That bill has 6 votes, which is enough to get out, but we're holding all the bills on call.
Thank you so much,
Thank you very much.
Thank you.
Assemblyman Della Torre, you have 4 items, starting with file item 2, AB 2. And welcome.
Thank you, Madam Chair and members. I'd like to start off by accepting the committee's suggested amendments to deposit the DMHC fines in the Managed Care Administrative Fines and Penalties Fund and the CDI fines in the Major Risk Medical Insurance Program. Mr. Mipp. Assembly Bill 2 is intended to stop health insurers and HMOs' unscrupulous practice of dumping sick patients after their policy has been approved. Specifically, the bill requires health plans to go through an independent external medical review process before rescinding or canceling policies. It offers the consumers the ability to opt out and sets clear standards for medical underwriting for health plans prior to issuing individual health care contracts. AB 2 also requires DMHC and the Department of Insurance to establish standard information and health history questions for use on application forms so that there's no confusion about what questions can be asked. The bill protects consumers by requiring that they continue to receive care while the rescission is reviewed. Recently, in the last couple of years, Blue Shield had to reinstate some 700 policyholders that they illegally rescinded their health care coverage. This was done by DMHC. In February, Anthem Blue Cross agreed to pay a $1 million fine to the over 2,000 people it dropped after they had submitted bills for expensive medical care. Also in February, HealthNet was fined for illegally rescinding over 800 people, and I could go on and on.
That's
Clearly,
not necessary.
I won't go on with the litany. Recently, the LA Times wrote an editorial in support of AB 2. Last year, we had editorial support from the Chronicle, the Times, and the Sacramento Bee. When illness occurs, people need to be concerned about their health and getting better, not about whether their health insurance company is going to dump them at their hour of need. I urge your aye vote.
Thank you, and I understand, Assemblyman, that you are taking the amendments and that they will actually be taken in judice in the next committee, but I know we have your word, so that's fine.
Thank you.
Two witnesses in support, 2 minutes each.
Thank you, Madam Chair and Senators. Teresa Stark with the California Medical Association. We are very pleased to be the sponsor of this measure. Very simply, as the Assemblyman said, this bill protects innocent patients who have made an honest mistake on their application for health care coverage. It does not protect people who lie in order to get coverage. And as you know, unlawful rescissions and cancellations have been an ongoing problem for several years. And despite a number of settlements and enforcement actions against health insurers and health plans, nothing prevents them from continuing this egregious practice. Rescission is retroactive. If it happens to you, it's as if you never had coverage in the first place. And if you're very ill and you have a lot of medical bills, which is usually what causes the insurers to start digging into your health history, you have no way to pay those bills and you have no way to get other coverage because then you have a pre-existing condition. Rescission is serious, it is permanent, it is devastating, and it shouldn't happen on a technicality. Because of the life-changing impact that it can have on a patient, it must be handled very carefully, very fairly, and very openly. Current law is not strong enough to protect these vulnerable patients, but this bill is. We urge your support.
Thank you. Second witness.
Don Ernst, immediate past president of the Consumer Attorneys of California. We are strongly in support of the CMA on this issue, and Assemblymember Hector De La Torre. This is a bill that is severely needed in California. It will protect consumers who, when they need their insurance the most. I can tell you the story, and I had a witness that was going to come. Her name was Jessica Bath. She was a woman who wanted a child, applied, received health insurance. They paid for her prenatal care, and they paid for her delivery. 3 days after the child was born, it was determined the child had a bad heart. It needed a major surgery. The child had to be at least 10 pounds, and it was going to be 7 to 10 months before the child was old enough for the surgery. 6 months out, she received notification in the mail that her health coverage, and therefore that of her newborn child, had been rescinded. It had been rescinded because she hadn't put down that she'd taken some medication during finals exams a year and a half earlier at Cal Poly. And in truth and fact, they left her high and dry when most needed. I cannot tell you the importance of having the material misrepresentation standard imposed and the importance of having a standardized form. How it really works is when people apply for insurance, they fill out the form. Insurance is granted, little or no underwriting, and then within 2 years, if there's a major issue, the insurance carrier will send out for their medical records, which the patient has never seen. They will review those medical records, and if anything is inconsistent, they will rescind the coverage. It is a business model. It is being utilized. This bill is truly needed in California. We thank Assemblymember Hector De La Torre for bringing it, and we support this bill and would urge your aye vote. It is a good vote for consumers. Thank you.
Further witnesses in support for identification purposes only.
Mr. Chair, members, Tom Riley with the California Academy of Family Physicians and Osteopathic Physicians and Surgeons of California urge your support.
Thank you.
Randy Hicks, Californians for Disability Rights, in support.
Thank you.
Beth Capel, representing Health Access California, California's Consumer Coalition, also in support.
Thank you.
Michael Eaga on behalf of the California Teachers Association, in support.
Judith Michaels, California Federation of Teachers, in support.
Ed Guzman on behalf of the California Alliance for Retired Americans, and more in support.
Thank you.
Chad Silva with Latino Coalition for Healthy California, full support.
Thank you. Witnesses in opposition?
Maybe those folks could
Could you maybe give up the seat so everybody can sit around the table? Thank you.
Wrong bill.
Sorry, to the chair and the committee members, I wanted to clarify the author's amendments adopted. But thank you very much. Charles Bakke with the California Association of Health Plans, here in opposition to AB 2 today. Health plans are on record as supporting some what we believe are needed improvements to the process for rescinding coverage in the individual market. For example, we support improving the questions up front. We also support defining medical underwriting in a much more clearer way. We also support an independent third-party review process that takes the decision to an unbiased panel who can consider whether or not a rescission is appropriate, an appropriate remedy on a case-by-case basis. Some of those provisions are in this bill, and it's unfortunate, however, that the bill does contain an intentionality standard, which we are strongly opposed to. It was a standard put into this bill in Senate Judiciary Committee last year in a previous form. We believe that the intentional standard will increase litigation, increase costs, and restrict coverage for those in the individual market. And in effect, by requiring us to prove this standard, an intentional standard, it really ensures that litigation is the only way we can actually rescind coverage. Obviously, as I've stated, that will increase cost, and we think will have devastating impact on the individual market. For example, health plans and insurers that use rescission as an avenue to root out abuse when folks willfully or misrepresent themselves on their application for coverage, if we know that we're going to have to meet such a high standard, it will increase, as I've stated, our legal costs, but it will also increase our premiums because we will have to adjust our risk with the knowledge that people can misrepresent themselves on their application, and we don't really have a remedy anymore to enforce accuracy on the enrollee's part. Another consequence of this is that it actually will make it more difficult for plans to choose to enroll people in the individual market because, once again, if we're unclear that if we do our job and complete medical underwriting and yet we still have to prove this higher legal standard, it is a real risk on our part to go ahead and sign them up. So it could actually have the impact of restricting the offerage of coverage in the individual market. And then finally, I'd just like to point out that another main concern we have with this bill is that it includes cancellations. We appreciate the author has taken an amendment earlier on to allow for some cancellations to be exempted from this bill. We believe that in general, canceling a policy is different than rescinding and should not be included in the scheme in this bill. And for those reasons, we are opposed to AB 2 and we ask for your no vote. Thank you.
Next witness has a minute and a half.
Thank you, Mr. Chair. Ann Eowam with the Association of California Life and Health Insurance Companies. And with your indulgence, I might just share my minute and a half with my colleague, Marty Fisher. I echo all of the objections that were raised by Mr. Bakke. We share those same objections. I would also point out that things have changed a bit since this bill was put in the last time. As the author has mentioned, there have been a number of changes in the way insurers and health plans are handling rescissions. In addition, the Department of Insurance has just sent out a new whole list of regulations designed to clarify the underwriting process, the questions that can be answered, what form of underwriting you must do, how you are to proceed, and all of this is intended to make sure that rescissions are the last resort. And so we think that the bill is unnecessary as it is to have an intentional standard, and we think that with that intentional standard, we would not have the ability to rescind a policy when fraud has occurred because it's so difficult to
Are you
improve
sharing
that.
your time with someone?
Yes, and I'm done. Thank you.
Yes, thank you.
Thank you, Madam Chair.
Marty Fisher on behalf of the California Chamber of Commerce, and I just want to add a couple of things. We have identified this bill as a job killer because we believe that it will increase the cost of premiums in the individual market because you're allowing the individual to misrepresent their health condition in order to obtain health coverage without any intentional without any intent to misrepresent. So we think it'll increase premiums. Thank you.
Thank you very much. If anyone else would like to state their name and their position.
Natalie Cardenas on behalf of Anthem Blue Cross in opposition for the reasons stated.
Stephen Lindsay with the California Association of Health Underwriters in opposition.
Thank you.
Dan Chick with HealthNet in opposition.
Thank you.
Mark Weideman, Blue Shield of California in opposition.
Thank you.
Jolinda Thompson, California Association of Dental Plans, who are opposed unless amended to take out the specialized plans. We appreciate the author and the staff continuing to work with us on the language to do that. Thank you.
Thank you, Madam Chair. Marino Hamlet representing Delta Dental. We are also opposed unless amended for the reasons stated by Ms. Thompson. Dental plans don't collect health history information. We don't rescind based on health history. There's no reason to put us through this whole scheme in the bill. Thank you.
Thank you. Comments from committee? Senator Cox?
Madam Chair, let me, it's been some time, by the way, since Suleiman and members of the committee that I have taken an application, but I will tell you I remember it. I remember the application process well. It begins something like when you begin asking questions about medical condition, it says something like, to the best of your knowledge and belief, have you ever had or do you have? And then it goes down to list the various things relative to the heart and wants to know whether or not you're diabetic and in all of those kind of situations. It seems to me that this bill, in all fairness, simply goes too far. The applications are reasonably clear. I have had any number of people say to me over the years, well, you know, Dave, I had this happen in such and such. Should I list that? And the answer was, yeah, you ought to list that if that's what your situation was. You can't expect a company to insure a burning house once they find out that the house is burning and that you knew about it at the time you made application. Material misrepresentation is a very important aspect, and we can't expect companies not to use the remedies at law relative to terminating a contract if, in fact, there was material misrepresentation. And I can tell you that looking at applications and having them filled out, there is no way you can misunderstand what that question says about a particular condition. There's just no way that you can misunderstand that. It is so clear simply because of the fact that the company doesn't want to be in a situation of rescinding a contract. So I believe this bill goes too far, and in fact, I concur with those who talk about the aspect of what it does to the individual marketplace, what it does to the pricing of the contract, and if that's the goal and objective, you clearly will have done that. I don't believe that's your objective, but I do believe this bill goes too far. Thank you, Madam Chair.
Other comments? Senator Pavley.
If the Assembly member would just respond to, I think, the last two witnesses in opposition regarding dental.
Fine. And are there any other questions? As Assemblyman can do it on his close. Are there any other questions? Okay. Assemblyman Delatorre, if you would like to close, and also please include what Senator Pavley said about responding to the last two witnesses' comments.
Yeah, absolutely, and I'll start with that. We are talking,
and Senator, yes, and Senator Cox.
We are talking to the dental plans. They are clearly a different kind of plan than what we see in this plan. They are right; they have never been in that loop of rescission, and so we are talking to them, and I think we're fairly close on a solution to their concerns in terms of this legislation and it applying to them.
Yeah. Let me say that the bill is going to Judiciary, so there's another good look at it. And in addition, Assemblyman Delatorre is taking amendments from our committee that will be taken in Judish.
In terms of the other points that were made, the main concern with needing to do this legislation the way we're doing it is right now the health insurers are judge and jury. They're the ones who determine whether or not it was right or not that somebody omitted something, and then they determine whether they should rescind or not. That's the current practice. The problem with that is they're the only ones who are making that decision. There's nobody looking over their shoulder. And as we've seen by the examples that I cited, with all of the different fines that have had to been paid and all the people who had to get reinstated on their health insurance, the insurance companies have misapplied the rule because otherwise they wouldn't have settled with DOI and DMHC on every one of these cases. Every single rescission over that time period was reinstated. Every single one. And that was when the appropriate regulatory body stepped in and took action. So what we're saying in this bill is on the front end, when they want to make a rescission, they need to get either DOI or DMHC to review it and approve it before it happens. That way you don't have any question about whether it was the right thing to do or not. That is a simple solution to the problem. They have shown, again, by their practices that they cannot be allowed or trusted to do it on their own. Because, again, by definition, thousands of people that they rescinded were reinstated by their negotiated settlements with DOI and DMHC. We shouldn't have to do mass settlements with the regulatory body and the health insurers when they make mistakes like this. We should have a process on the front end that protects the consumer and protects the insurance company so that they don't have to double back and reinstate people that they cut off illegally. So in terms of the point about insuring a burning house, currently they are going back only when someone has major medical expenses. So they get cancer, they get a heart attack, etc. And that's when they go back and review their records. They're not doing it on a day-to-day basis.
Mr. Delatour, what the application says is, to the best of your knowledge and belief, do you have or have you ever had? There is no ambiguity about an application on an individual basis. No ambiguity. Now, I suspect this bill gets out today, but when it comes to appropriation, I will bring you applications from every single company in the state of California, major company, that underwrites individual, and you can take a look at the application. There is no ambiguity.
And I can tell you anecdote after anecdote of people who have misunderstood or not known the fact that ended up being the cause for their rescission, and them getting reinstated after the fact for that omission that you say is black and white, but clearly wasn't.
Sometimes insurance companies, it becomes a matter of just the economics of whether they reinstate or they don't reinstate, whether they get into a contest based upon a lawsuit. There are all kinds of considerations as to why they might do that. And I sense that we don't want to spend a lot of time on this because this has got 3 or 4 more spots. And I will bring you, though, the application so that you can see.
I would appreciate
wait a minute. We're going to do this through the chair.
I'm sorry.
Sorry.
Through the chair.
Thank you both. So, Senator Cox, I think you've made your point. Do you, in one sentence, do you have something to add before you close?
I've closed, ma'am. Thank you.
You have closed. Okay. And Assemblyman Delatour, you've got 3 sentences to close.
I will use one. In Washington, D.C., there was a congressional hearing on the practice of rescission, and I will close with a quote from Republican Congressman Michael Burgess from Texas. No one can defend, and I certainly cannot defend, the practice of canceling coverage after the fact. There is no acceptable minimum to denying coverage after the fact. That is a Republican congressman from Texas.
Thank you very much. Is there a motion on the bill? Senator Pavley moves the bill. Call for the vote.
Senator Alquist?
Aye.
Alquist, aye. Strickland?
No.
Strickland, no. Onnested? Cedillo? Cox?
No.
Cox, no. DeSagne? Leno? Maldonado? Negretti McLeod? Pavley? Aye. Pavley, aye. Woke.
That bill has 2 votes. It would need 6 to get out, and it is on call. What I'd like to do next, since at some point I will be leaving again to present another bill in a different committee, I'd like to take file item 17 next, because I just would like to make a comment or 2 at the very beginning. This is AB 730. And I actually have 2 comments that I'd like to make at this point, since I'm not quite sure how long I will be here before I'm called to the other committee. First comment is I will be supporting the bill because I think the $118 is extremely low for these kinds of violations. So I'm glad to see an increase in the penalties, but I also need to say to the author that I think that for the $10,000 level, I think it should be willful, which I know you, as the author, have not agreed to take. So I'm just putting that out there. I am supporting it because of the other end of the $118 being way too low. But I do want to express to you that in order to be consistent with some other legislation, including your legislation, that I do hope at some point that you will change the $10,000 to willful. And with that, you may present your bill.
Thank you. I'll start off by accepting the committee's suggested amendments to deposit the fines into the major risk medical insurance program. I think we've been trying to connect on that other issue, and I look forward to having that discussion. It is interesting to me that in a little bit.
And the amendments you are taking will be taken in judice. Yeah. Yes, that you've agreed to. Thank you.
In a little bit, we're going to have some folks come up here and argue exactly the opposite of what they just argued on the standard relating to this standard. So that's very interesting to me. Assembly Bill 730 will allow the insurance commissioner to increase civil penalties for health insurers who unlawfully engage in post-claims underwriting. This is after they've been found to unlawfully engage in that practice. The fines would increase to an amount not to exceed $5,000 if the insurer knew or had reason to know that the act of post-claims underwriting was unlawful. The civil penalty would be an amount not to exceed $10,000. Those dollars are roughly equivalent to DMHC fines for the same practice. Under current law, DMHC can go up to $2,500 per violation, but they also have jurisdiction to make adjustments above and beyond that. So that's why we are doing this legislation, to make sure that there is comparable. The whole idea of fines is that you are dissuading people from engaging in a practice that's unlawful, and obviously $118 a pop isn't enough when you're saving millions of dollars on the back end. So with that,
thank you. And your witnesses, 2 witnesses, please.
So David Link with the Department of Insurance, with the sponsor of the bill. We think that the current penalty sends the wrong message to the insurance industry, and I don't think anybody ever intended that in the beginning, but the fact is that we know enough now that we do need to increase these. We agree with the chair that the willful standard would probably be much clearer in this bill. On the other hand, it is clear from the language that there are 2 levels of intentionality here. The $5,000 penalty is for some kind of either innocent or negligent mistake. The higher penalty, we would have to prove some kind of intentionality, whether that's actually willful or not. The fact is that we couldn't just charge that for something that was negligent. There has to be a difference between the 2, and we think that a court would probably read some level of intentionality into that second standard. So we urge your aye vote.
Thank you. Second witness for 2 minutes.
Beth Capel on behalf of Health Access California. We're here in support, even though we think that a fine of whether it's $5,000 or $10,000 is fairly modest given the damage that rescission can do to a consumer. We do think it's substantially better than $118. Some of us have paid traffic tickets more than that. So we appreciate the department and the author coming forward to improve the fines.
Thank you. Others who would like to state their name and support?
Chad Silva with Latino Coalition for Healthy California, and we support the bill.
Thank you.
Vic Guzman on behalf of California Alliance for Retired Americans, and we are in support.
Thank you very much. Witnesses in opposition.
Jason Gappart with the Association of California Life and Health Insurance Companies. We have an opposed unless amended position on the bill. We're okay. We have no problem with the increase in the fines. We believe $118 is too low. We're fine with the $5,000 and $10,000. But we believe right now, as the bill is currently written, there really isn't 2 standards because it specifically states if the insurer knew or had reason to know that the act of post-claims underwriting was unlawful, then there'd be $10,000. Everyone knows that it's unlawful. It's in the code. So we figured each time that there was a violation, we're afraid that's going to be the maximum $10,000. We proposed amendments. We did have a willful standard earlier. We now suggested more of a knowingly standard, and we specifically, we've given these to the committee. A knowing violation of this subdivision is subject to a civil penalty fixed by the commissioner, an amount not to exceed $10,000. We believe this goes along more with the intent of the CDI and conforms more with the DMHC and other codes in the insurance section.
Thank you. Others in opposition? Comments from committee? Senator Pavley.
Excuse me, Madam Chair, maybe you could explain to me a little bit on the willful violation, the legal language,
okay,
how that's different from knew or should have known.
Okay. I'm going to let you do this.
Senator Papley, willful is the language that's used in the insurance code for other major violations. That's what CDI has indicated.
Right.
So
a higher
it is a
level?
higher standard than knew or should have known.
With fines?
With fines equivalent to those 2 standards being applied by CDI.
Okay. Is there a motion on the bill? The bill has been moved by Senator Negrete McLeod. Call for the vote.
Senator Alquist.
Aye.
Alquist, aye. Strickland.
No.
Strickland, no. Onnested. Cedillo. Cox.
No.
Cox, no. DeSaulnier. Leno. Maldonado. Negretti McLeod. Negretti McLeod, aye. Pavley. Pavley, aye. Woke. It's got 3 votes.
That bill has 3 votes. It is on call. I have to present a bill in another committee. Vice Chair Strickland will preside.
So, Assemblyman, you want to go to item number 4, AB 98?
Yes, thank you.
Thank you.
Mr. Chair and members, AB 98 will require all individual and group health insurance policies regulated under the Department of Insurance to cover maternity services for women in California. This legislation will close a loophole exploited by health insurance companies in order to sell cheap coverage. This measure is similar to my AB 1962, which was vetoed by the governor last year. HMOs are already required to include maternity services in any health policy they offer. Individual health policies do not. Group health plans for small employers and above are required by federal law to have maternity coverage included in their policies. Individual policies are not. So you have 2 of the 3 components of health insurance mandating it, and the third obviously doesn't. This bill would only apply to CDI-regulated policies, while DMHC policies make up the majority of the private insurance market. CDI policies represent a substantial portion of those products sold in the individual market. Almost 40% of the individual market is DOI regulated. Maternity care not only improves birth outcomes, it can also reduce costs for newborn care. For example, average health care costs, including both inpatient and outpatient care, were about 10 times greater for a premature baby during the first year of life, about $30,000 compared to $3,000. That's a significant difference that we end up having to pay because the mothers don't get the proper prenatal care. Furthermore, women are pushed into state-funded programs such as Medi-Cal or Access for Infants and Mothers. Based on data from AIM as of 2007, about 6% of their total enrollment were enrolled in health insurance policies that did not cover maternity benefits. So they had insurance, but we were still paying for them as taxpayers through these public programs. In addition, 10% of the total enrollment were enrolled in policies that did cover maternity services, but these services were inadequate or carried high premiums, high deductibles, and therefore they still used the public option. So for the taxpayers, we are ending up having to subsidize these plans. In 2008, 22% of women in the individual market had maternity coverage, compared to 82% in 2003. You see the significant drop from 82% down to 22% in just 5 years. Approximately 600,000 Californians are enrolled in insurance plans without maternity services, and about 26% of them are at childbearing age. In this year's CHBRP report, they estimate that the increase per member per month cost for everybody, if you were to mandate maternity service, would be $7.17. That's it. Per month, $7.17. Women never need treatment for prostate cancer. Men will never need treatment for cervical cancer. And childless couples will never need pediatric care. But all of these services are mandated for coverage by health insurers. This bill is a necessary step to balance that out. We have support from Blue Shield and Kaiser on this legislation. And here to testify with me is Beth McGovern from the Commission on the Status of Women and Shannon Smith Crowley on behalf of the American College of Obstetrics and Gynecologists.
Witness in support, please.
Beth McGovern, representing the California Commission on the Status of Women. We are very pleased to be the sponsor of this bill. Maternity care is essential, fundamental health care for women. And since women are the only ones who need health care coverage for maternity services, insurance policies that provide basic health care benefits for men but don't provide basic health care benefits for women because they don't provide coverage for maternity services are discriminatory based on gender. even where policies that include coverage for maternity care are also available, it's penalizing women for being born with different body parts than men are born with. And that's also discriminatory. When women have to pay more than men for basic health care, that is gender-based discrimination. And that economic burden on women is magnified by the fact that women, on average, make only about 77% of men's wages, so women have less ability to pay for expensive health care costs. And that burden is even more substantial for women of color who, on average, make even less than that. Enrollment in these trimmed-down policies that don't include maternity coverage have tripled in the last 4 years. And policies with maternity coverage are getting even more expensive and harder to come by. In fact, sometimes women are not even able to find insurance policies that they want to buy, and to find any insurance policies that have maternity coverage. Group health plans are already required to provide coverage for maternity care, but different rules apply to the individual insurance market, and the same anti-discrimination protections are not in place. This bill essentially closes that gap in current law. Women should not have to pay more for basic health care than men do, and all insurance policies should be required to provide maternity coverage, which is exactly what this bill does. We urge your aye vote. Thank you.
Shannon Smith Crowley, representing the American College of Obstetricians and Gynecologists for California. We support this bill due to the devastating impact of what the status quo will have on women, infants, families, and the state. When women are not covered for maternity, and with 50% of pregnancies uncovered, as the Assembly member said, we will either have them turn to state programs at increasing costs, or they may try and go bare. One of the problems we have with them going bare is that they may try to negotiate which tests that they're going to undertake, maybe essential tests that could root out early complications that could be resolved if they had the correct care. Also, even if they get into a state program, there may be a delay by the time they figure out that they're pregnant and they figure out that they're entitled to join a program. Lack of early prenatal care puts a woman at 3 times greater risk for preterm birth. This problem is only going to get exacerbated as this market continues to change. We're going to have more babies that are born too early, too small, or with otherwise avoidable problems. So not only will we have Medi-Cal costs, AIM costs, but we'll have California Children's Services costs and educational and social services costs. Blue Cross's letter in the analysis said that this bill would eliminate choice in the market. Well, I would like to posit that this practice is eliminating choice. Women are being priced out of this market. They will be unable to afford this coverage, and so they may end up being uninsured completely. Also, it's interesting that while the basic preventive coverage is not covered, complications are. And that's kind of interesting about why would the cheaper coverage not be included. Well, it is interesting that many of the players in this market that fail to cover maternity also gain as they are participants in the managed Medi-Cal and AIM programs and get state monies when the women do become pregnant. We think that this is basic preventive care. It was an oversight. The insurance code never was set up to define what basic benefits were. It's time to correct that. We ask for your aye vote.
Thank you. Other witnesses in support for identification purposes only.
Beth Capel, on behalf of Health Access California, pleased to be here in support.
Mike League, on behalf of the California Teachers Association, in support.
Charlotte Newhart with the California National Organization for Women and the American Association of University Women, strong support.
Kathy Mossberg, California Family Health Council, in support.
Erin DePay, Planned Parenthood Affiliates of California, in support.
Chad Silva, Latino Coalition for Healthy California, in support.
Teresa Stark, California Medical Association, in support.
Terry Calgar Hill, on behalf of the California WIC Association, in support.
Sharita Lane, California Children's Hospital Association, in support.
And Mark Weideman, Blue Shield of California, support.
Witnesses in opposition?
Thank you. Ann Iowan with the Association of California Life and Health Insurance Companies. We certainly don't disagree with the proponents' desire that women have as much comprehensive coverage as they possibly can afford. And in a perfect world, that would be wonderful. The concern that we have with this bill, as we've had when it's been introduced in other years, is that it makes the assumption that if we made the coverage more comprehensive and therefore more expensive, that those women would then buy it at that time, or other people who don't want to buy maternity coverage. Every single one of my member companies that is in the individual market, and there's only maybe 5 or 6 large companies, all offer comprehensive coverage that includes maternity. And if you ever went online, you'd see it's very clear to see what includes maternity and what does not. The reason that people are picking more of these policies is because of price. It's been stated that the average price is about $7 a month. If you look at the CHBRP analysis, it ranges anywhere from 2 to 27% in increased prices. You will have probably gotten some letters from some of my member companies that say in their policies it might be as much as 102%. The CHBRP analysis states that 7,600 people are expected to drop coverage and go bare. And if I may just say something about the AIM program, these are the poorest women, and this state has determined that they are too poor to afford coverage without state subsidization. The fact that they have any coverage at all that they're paying for is amazing. But what makes them eligible for the AIM program or Medi-Cal is the fact that they become pregnant. And what woman is going to continue to pay $100 or more a month for health insurance when she can now be eligible for AIM that will subsidize her coverage, and she will pay no more than, say, on average, $540 over a 2-year period total? So even if we were to mandate maternity coverage, they would likely drop their coverage to get the subsidized coverage anyway, because we've already made the decision as a state that they're too poor to not get subsidized health insurance. And so saying that we're switching over to AIM and that we're taking up state funds, I think it's a design of the program to try and help those who are the poorest. So with those reasons, we are opposed to the bill.
Other witnesses, opposition.
Yes, Michael Shaw, National Federation of Independent Business. There are about 3.5 million small businesses in the state of California, some of which use individual health insurance as their method to purchase health insurance because they're unable to provide it to their entire business or to purchase it as a group. So this benefit mandate would certainly hurt a lot of them and their ability to purchase insurance to cover themselves. And small businesses are a very price-sensitive group of individuals who do everything they can to keep their business afloat, including making many personal sacrifices, including health insurance. It's also important to note that the population most impacted by this are the young, and the quote-unquote $7.17 per member per month is an average across the market. It's not an individual who doesn't have coverage is going to have an additional $7.17 a month. It's likely to be a much higher amount because that $7.17 is looking at an average across the entire individual health market. And obviously that is a significant number of those individuals already have this coverage, and they may see their premiums go down as a result. It's also, we think, important to note that, as was noted earlier, CHBRP's analysis indicates that for those who do not have coverage, we're looking at as much as a 27% increase. There's been indication testimony that that might even be a higher amount. And of course, this bill has been introduced several times before, and in the last 2 rounds has been vetoed by the governor, and there's no difference in this bill versus those, and we believe that that policy has not changed.
Thank you. Other witnesses for identification purposes only.
Natalie Cardenas, Anthem Blue Cross, in opposition.
Marty Fisher, California Chamber of Commerce, in opposition.
Stephen Lindsay, California Association of Health Underwriters, in opposition.
Questions from members? Will of the committee? All right. Senator Negrete McLeod moves the bill. Secretary, please call the roll.
Senator Alquist, Strickland?
No.
Strickland, no. Onnested? Cedillo? Cox? Cox, no. DeSaulnier? Leno? Maldonado? Negrete McLeod? Negrete McLeod, aye. Pavley? Pavley, aye. Woke.
That bill has 2 aye votes, remains on call. Assemblyman, file item 11, AB 511.
Thank you. Mr. Chair and members, I'd like to begin by accepting the committee's suggested amendments to limit DHCS's flexibility as suggested in the analysis. AB 511 seeks to increase Medi-Cal reimbursement by establishing a quality assurance fee program for ambulance services. Ambulance providers would be assessed a fee up to as much as 5.5% of their gross revenue, and requires that revenue from the quality assurance fee be used to
Move as
increase
amended.
federal financial participation. It's a very simple concept. We did it for senior assisted living homes a couple of years back. Want to do it here as well. With me today, I have Joe Yaka and Lou Meyer.
I believe there's support on both sides. Moved as amended, but please.
I'm sensing the will of the committee. Joe Yaka, American Medical Response, we're the sponsors of the bill. I think the Assemblyman set it out straight. We're just looking for a solution rather than cursing the fiscal condition of the state here, and we ask for your support.
Mr. Chair, Chris McKaylee on behalf of the California Ambulance Association. We support the measure in concept because we are doing a work group with the department and the sponsor and the author, and we have to model the proposal and make sure that all the component parts work so that we do get a QAF in place. Thank you.
Great.
Mr. Chairman, members, Ralph Hine for the California Fire Chiefs Association, Fire Districts Association, in support.
Thank you. I understand that there's no opposition, and I move the bill as amended. Any questions? No, please, Madam Secretary, call the roll.
Senator Alquist, Strickland. Strickland, aye. Onnested. Cedillo. Cox. Cox, aye. DeSaulnier. Leno. Maldonado. Negretti McLeod. Negretti McLeod, aye. Pavley. Pavley, aye. Woke.
That bill has 4 aye votes, remains on call. As you can see, some members are not here. So, thank you. Assemblyman Hall, are you next? Oh, no, I'm sorry. I'm sorry. False alarm. Assemblyman Portantino, I'm sorry. I didn't see you over there. It's a nice suit that you have over there. Sorry.
I'll let the Italian from Florida go. That's supposed to be Italian suit.
File item 6, AB 221. Assemblyman.
Thank you, Mr. Chair and members. Over the past 3 years, the legislature and the governor have advocated widespread routine HIV screening. Barriers to screening have been erased so that California can attain an optimal environment for people to learn their HIV status and get life-saving treatment. The purpose of AB 221 is to remove yet another barrier. The most essential tool for expanding access to HIV screening is the Finger Stick Rapid Test. This technology is the same used by hundreds of thousands of diabetics on a daily basis with no training. My mother being one of them, and my daughter likes to shoot the little cannon into her grandmother's finger. I can't explain it. Under current law, state-certified HIV counselors also must be certified as a limited phlebotomy technician before they can administer the finger stick test. Since this LPT certificate training is focused on basic phlebotomy, it covers very little that is not already covered in the HIV counselor training. AB 221 will exempt an HIV counselor who works under a licensed physician and surgeon from a redundant limited phlebotomy training. This will allow HIV testing sites to use their limited funds to test as many people as possible, as safely as possible. With the help of the California Nurses Association, we amended the bill to add curriculum content to the current HIV counselor training program that includes infection control and proficiency in administering the finger stick test. This measure passed the Assembly 74-0, and I ask for an aye vote.
Witnesses in support.
Mr. Chair and members, Rand Martin on behalf of AIDS Healthcare Foundation. AHF is the largest private tester in California. We've been engaged in a major effort for the last many decades trying to identify as many people as possible who are HIV positive. The Assemblyman has outlined the bill very well. I would simply add that we're currently spending about $2,500 to redundantly train a person as an LPT who is already receiving the training as an HIV counselor. We think that money can be better spent getting to more people so that more people can identify their HIV status and we can get them into care and treatment. With those comments, we would urge your aye vote, and thank you very much.
Other witnesses in support?
Kathy Mossberg, I'm sorry, Chair and members. Kathy Mossberg, representing the San Francisco AIDS Foundation, a proud co-sponsor of the bill, and not much to add to the comments made. We strongly urge your aye vote. Thank you.
Other witnesses?
Donna Seitz, representing Los Angeles County Board of Supervisors, in support.
Thank you.
Charlotte Newhart, with the Directors of Maternal, Child, and Adolescent Health in the counties, in strong support.
Thank you.
Erin DePay, Planned Parenthood Affiliates of California, in support.
Thank you.
Maureen O'Haron with AIDS Project Los Angeles, in strong support.
Randy Hicks with Californians for Disability Rights, in strong support.
Thank you.
Nicole Wortelman, City and County of San Francisco, in support.
Teresa Stark, California Medical Association, in support.
Thanks.
Michael Martinez for Sacramento Center for AIDS Research Education Services, in strong support.
Witnesses in opposition? See none. Senator Pavley, I'm sorry. Senator Cox. The bill has been moved by Ms. Pavley. Senator Pavley.
The bill has been moved. It seems to me that the California Association for Medical Laboratory Technology offered a very reasonable amendment, which, can you tell me how that which you set forth addresses the issues that they have put forth, which has to do with 10 hours of didactic training and 15 successful finger sticks for certification as an HIV counselor? Can you explain to me how that which you have taken encompasses the organization, the California Association for Medical Laboratory
Yes, sir. I'll comment, and then I'll have my sponsor comment. You know, it's my belief that the amendments that we worked with the California Nurses Association address that issue. That was more germane to the earlier draft of the bill. The specifics of that training I'll leave to Mr. Martin.
Yeah, Senator Cox, again, Rand Martin on behalf of AIDS Healthcare Foundation. In current law, the policy was set in statute. The Department of Public Health developed regulations in which they put the specifics, like how many hours and how many finger sticks were appropriate. We think that's the venue in which you should do that. What this organization wishes to do is to take that specificity and put it into statute. We think it's much better for the Department of Public Health to make those decisions about what's appropriate in terms of the training once the policy has been set by the legislature.
Okay. Thank you.
The bill has been moved by Senator Pavley. Secretary, please call the roll.
Senator Alquist, Strickland.
Aye.
Strickland, aye. Onnested. Cedillo. Cox.
No.
Cox, no. DeSagne. Leno. Maldonado. Maldonado, aye. Negretti McLeod. Negretti McLeod, aye. Pavley. Pavley, aye. Woke.
That bill has 4 votes and will remain on call. Thank you, Assemblyman. Assemblyman Hall. Members, this is file item 14, AB 599.
Mr. Chair and members, let me first begin by thanking Senator Alquist, Senator Leno, the Senate Health Committee staff, and the Senate Public Safety Committee staff for all their work, and to accept the amendments that are in the mock-up form of the author's amendments. As amended, AB 599 would exempt a forensic alcohol analysis laboratory from proficiency testing by the Department of Public Health if it is accredited by the American Society of Crime Laboratory Directors and requires the Forensic Alcohol Review Committee to submit a summary of revisions to the Department by December 31st, 2010. The Department of Public Health's current proficiency testing is duplicative in nature and wasteful of taxpayers' dollars. By exempting laboratories that are accredited by the American Society of Crime Laboratory Directors, we would be able to save limited state resources and revenues and ensure the highest level of proficiency testing by forensics blood alcohol testing labs in the state. The measure was unanimously approved by the State Assembly It is supported by various law enforcement agencies and AFSCME. I respectfully ask for your aye vote. Here to answer technical questions are Bill Phillips, President of the California Associated Crime Laboratory Directors, Patty Uri, retired supervising criminalist of the San Diego Police Department in Alcohol and Narcotics section. Thank you.
Okay. So you're here to answer questions, or would you like to witness support?
I'd like to make a statement.
Go ahead, please.
My name is Bill Phillips, and I'm the immediate past president of the California Association of Crime Laboratory Directors and the laboratory director for the California Department of Justice, Toxicology, and Alcohol programs. And I would like to urge that you consider that in this time of budget crisis that we propose that the department relinquish their duplicative process of proficiency testing of public and private laboratories in California. The labs must perform proficiency testing by the ASLAD lab, American Society of Crime Laboratory Directors, as directed by the Health and Safety Code 10702. My associate will speak to the quality of the ASLAD laboratory. ASLAD laboratories are no longer voluntary, so we have to participate in ASLAD laboratories proficiency testing program to receive federal funding. And laboratories in California that are doing DNA testing also have to participate in an accreditation program. So what I would like to do is propose that this unnecessary testing by the Department of Health be stopped, and that we can assure that the highest quality of testing is done by ASLAD laboratory. Thank
Other
you.
witnesses in support?
Yes, Patricia Lowe, Yuri, if I may also make a statement.
Sure.
I am also a founding member of the Forensic Alcohol Review Committee. I've just resigned that capacity this summer. Also supervising criminalists retired from San Diego Police Department as well as San Bernardino County Sheriff. Personally analyzed over 10,000 samples for alcohol analysis and testified hundreds of times as an expert witness in court on those issues. The Forensic Alcohol Review Committee is a bit behind in the work. There hasn't really seemed to be much of an urgency on that. They're about 4 years behind. But I'm very comfortable that we have the majority of the work completed at this time. We should have absolutely no problem meeting the deadline as stated in the bill right now. There are significant differences between the state program and the approved program with accredited labs. A lab with 12 individuals, for instance, a Department of Justice state crime laboratory, if they were to take the state proficiency test program, they would be subject to 12 samples of analysis a year. An analyst, once becoming an analyst and doing work, is never throughout their career ever required to ever be proficiency tested in that career. On the other hand, an accredited laboratory analyst must be tested every single year. And that same laboratory with 12 analysts, which would have had 12 samples analyzed a year, there would be 48 samples analyzed a year in an accredited program, far surpassing that. The state program also, it's not only is it redundant, but it is not recognized by the law, by the Health and Safety Code. So the crime labs are having to take both tests to comply with the state, which is not in compliance, and then the accredited lab requirements. Myself, as an analyst for many, many years, proficiency testing is absolutely essential. It's the only way that I can maintain my skills and test my skills in doing that type of work. It gives me the confidence that I need to go to court and be very confident that the result I'm getting in my test is accurate, and I feel good about that. The more challenging the testing process itself is, the better I'm going to be and the better my skills are going to be as an analyst. So I ask your support of 599.
The bill's been moved by Senator Cox. Witness opposition? And by the way, the amendments will be in public safety.
Very well. Thank you.
Because it's
That is
being
correct.
double referred.
Yes, thank you.
Good afternoon, Mr. Chair, members. Ignacio Hernandez on behalf of the California Attorneys for Criminal Justice and also the California DUI Lawyers Association. Based upon the mocked-up language, we are willing to withdraw our opposition. There's just a technical clarification. I just got these today. And if once that's cleared up, then we would withdraw. The language states that the proposed amendment would be in effect until the amended regulations take effect sometime in the future. The only question I have, and maybe the sponsors or the authors can help me with that, is if the agency reviewing the regulations decides not to change the regulation but just leaves current regulations in effect, whether it would the current regs would apply or would this bill apply. That's my only clarification Because my understanding, this is a stopgap regulation. If that's, with that clarification, we would remove our opposition, and I thank the author for the work on this bill.
This bill applies until the regs are adopted.
Okay. And in the event that the provision dealing with proficiency testing remains the same as current regulation, the FARC proposes a change to current regs, and that change is then vetoed by the agency, which would then revert back to current reg. Okay, I just want to make sure that that's the process. That's how we understand it.
Right.
Okay. With that, we do remove our opposition. I want to thank the committee for all of its work.
Thank you. Any other witness opposition?
Yes, George Skridakis, Department of Public Health. We do have an opposed position on the introduced version of the bill. Our main issue is that we don't believe the ASCAP lab accreditation is as stringent or adequate substitute for the regulations that are currently in statute. And also, we believe there are significant differences in requirements for record keeping, proficiency testing, and employee qualifications. We also believe that ASCAP is a voluntary accreditation program conducted by laboratories themselves, which lacks regulatory authority.
Thank you. Other witnesses for identification purposes?
Clay Larson, Department of Public Health, in opposition.
Thank you. It's already been moved by Senator Cox. Secretary, please call. Oh, Senator Pavley, do you have a question?
Yes, to the gentleman with Department of Public Health. The analysis talks about that these standards are less stringent than current regulations. Could you, since you're sitting there, just articulate a little bit about your concerns about this bill?
Sure. The department's current proficiency testing program is a couple of differences between that. One, the frequency of testing is greater. The department recognizes that methods go out of calibration, reagents become the quality of reagent changes. So we require more frequency testing. We require an external proficiency test for each laboratory employee employed performing forensic alcohol analysis. ASCAP lab doesn't. The laboratory evaluates proficiency test performances the department evaluates PT performances of the labs based on standards that are set in the regulations. The ASCAP lab's performance proficiency review committee is actually it's a very confidential process. It's stated in their guidelines, so it's not clear what procedures they employ. So the department's current process is open, and the responses taken by the department to a failed proficiency test are stated in policy, and we've been following that for about 25 years.
Senator Pavley, you have another follow-up question?
Just one follow-up question, perhaps not to the man from the Department of Public Health, but someone there. Also in the, someone else on the panel. Also in the staff analysis, they talked about concern about DUIs possibly being affected. Department of Motor Vehicle would negatively impact the Department of Motor Vehicle hearings on driver's license suspension relating to DUIs, and if someone could address that.
Who would like to address that? All right.
Thank you, Senator. Ignacio Hernandez again on behalf of the California DUI Lawyers Association. As the bill is currently in print, it would have significant impact on DUIs and the procedures, which is the basis for our opposition. The proposed language,
with the amendments,
with the amendments, would not impact the DUI proceedings. The only difference would be instead of asking for the proficiency exams from the state, we would then ask ASCLD to provide their proficiency language. It isn't necessarily something that we would advocate, but it does address our concerns with the DUI proceedings. And I should note that these proficiency requirements are being reviewed right now by the FARC committee, so it's going to change in the next year or two, we expect. But it will not affect DUI proceedings as we analyze it now.
Okay.
Thank you.
All right. The bill's been moved by Senator Cox. Secretary, please call the roll.
Senator Alquist, Strickland. Aye. Strickland, aye. Honested. Cedillo. Cox. Aye. Cox, aye. DeSaulnier. Leno.
Aye.
Leno, aye. Maldonado. Negretti McLeod. Aye. Negretti McLeod, aye. Pavley. Woke.
The bill has 4 aye votes and will remain on call.
Thank you.
Thank you, Assemblyman. Who was next? I see Mara, but. Ma, please.
No.
Assemblywoman, you have file item 13, AB 543.
Good afternoon, Mr. Chair and Senators. The California Children and Families Account, which funds the Nurse Family Partnership, did sunset at the beginning of this year. Last year, I authored AB 1829 to extend the sunset for 2 more years, but the governor vetoed it with his generic veto message. So we are back. AB 543 would allow for implementation. Is it?
It's on consent here, isn't it?
This bill was taken off consent.
Ah, okay.
Okay, bye.
Bye.
Who was it by?
Because that,
By a member of our party that's not here, I guess. So, please, Assemblywoman.
AB 543 would allow for the implementation of the Nurse Family Partnership Program in California. This program matches first-time, low-income mothers in her first trimester of pregnancy to a registered nurse and assists them until their child is 2 years of age. When a woman enters into the Nurse Family Partnership, they are not only given the tools to be successful parents, they traditionally go on to graduate from high school and college. The program currently operates in 8 counties. It is not funded by taxpayer dollars, and Monica Miller, with the Nurse Family Partnership, the sponsor, will explain more about this program.
Mr. Chair and members, Monica Miller on behalf of Nurse Family Partnership. And as Assemblymember Moss said, there are no public funds that are used for this, no general funds, and we actually have protections in the legislation that specifically state that general fund dollars may not be used. It would be privately funded. We've actually raised to date $535,000 that we have sitting in a bank account ready to go into this account once it's reestablished. We had it at the very end of December when the program sunset, but we're advised that given the state of California's budget and everything going on, that it would not be prudent to put that money in for fear of it being swept into the general fund. Furthermore, President Obama in his budget has put in $8.6 billion into this program for California alone for the next 10 years, $124 million of which we'll be receiving on October 1st. So again, we're seeking private funds from private foundations. To date, have raised $535,000 that we have to go into this program. It's a wonderful program. Our success rate has been remarkable. We studied the program for 11 years prior to replicating it and have replicated it for the last 35 years and just have had amazing successes. So we urge an aye vote. Thank you.
Thank you.
Charlotte Newhart with the Directors of Maternal, Child, and Adolescent Health and Strong Support.
Thank you. Any witnesses opposition? Questions from members?
Move the bill.
Senator Leno moves the bill. Secretary, please call the roll.
Senator Alquist. Strickland.
Aye.
Strickland, aye. Onnested. Cedillo. Cox. DeSaulnier. Leno.
Aye.
Leno, aye. Maldonado. Maldonado, aye. Negretti McLeod. Negretti McLeod, aye. Pavley.
Oh, aye. Sorry.
Pavley, aye. Woke.
Listening to.
That bill has 5 votes, remains on call.
Thank you.
Thank you, Assemblywoman. Assemblyman Liu? You have 2 items. Where's the... File item 18, AB 773.
Good afternoon, Senators. AB 773 seeks to address the issues surrounding substandard care in California's nursing homes. This bill provides clarity to all residents and their loved ones by requiring a long-term facility to notify the primary contact of each resident when the facility receives a Class A or AA violation. These violations place patients in extreme and immediate jeopardy and represent the most severe case of nursing home abuse and neglect. We've worked with many of the stakeholders throughout the process, and the nursing homes are neutral on this bill. We saw a few questions. I vote. Have witnesses here in support.
Thank you. Witnesses in support.
Tamara Raspberry, Service Employees International Union. We think this is a very important bill. We're a strong supporter of the bill. If it were your grandparents or your parents in a nursing home, I think you would want to be notified if they received a gross violation of services. Thank you.
Thank you. Other witnesses in support?
Brandon Tartaglia with Disability Rights California in support.
Thank you. Any witnesses opposition?
Pat Blaisdell from the California Hospital Association. Among our members, we include about 125 hospital-based skilled nursing facilities. And while our members certainly support consumer and patient access to information, including the issuing of citations and survey results and such, we believe that the nature of care given in hospital-based distinct part skilled nursing facilities, the proposed written notification required by this law is impractical and unnecessary. As compared to freestanding skilled nursing facilities, which provide a great deal of long-term residential care, most hospital-based skilled nursing facilities provide short-term transitional care after an acute hospitalization. The length of stay for patients admitted to hospital-based SNFs is frequently much shorter than that in freestanding SNFs, sometimes only days or weeks. Given the time frames of investigating and issuing a citation by the state and developing the communication to the primary contact and mailing it out, it is more than likely that many residents or patients will have already left the facility. Notifying them of a citation serves no purpose and will only create unnecessary confusion for patients and families. For that reason, we oppose this bill.
Great. Thank you. Will of the committee, any questions? Senator Pavley moves the bill. Secretary, please call the roll.
Senator Alquist, Strickland. Strickland, no. Onnested, Cedillo, Cox. Cox, no. DeSaulnier. Leno?
Aye.
Leno, aye. Maldonado? Maldonado, aye. Negretti McLeod? Negretti McLeod, aye. Pavley? Pavley, aye. Woke.
Assemblyman, that bill has 4 votes. Will remain on call. File item 28, AB 1512. Assemblyman.
Thank you. I'd like to begin by accepting the committee amendments suggested in the analysis. This bill deals with the selling of expired products. At various retail pharmacies throughout California, products such as over-the-counter medicines and baby formula are being sold beyond the expiration dates. AB 1512 builds upon federal regulations which require an expiration or use-by date to be placed on infant formula or drugs by prohibiting retailers from selling these products after the dates in California. With me today are witnesses in support of the bill and our sponsor, the Consumer Federation of California. We support the request and I vote.
Witnesses in support.
Thank you, Mr. Chair. Ignacio Hernandez on behalf of the Consumer Federation of California. We are the sponsors of the bill. We've been finding, not only in California but throughout the country, that stores are selling baby formula, baby food, and over-the-counter medication far beyond the expiration dates or the use-by dates. This puts in jeopardy the health and welfare of especially young children because the nutrients that are required for infants begins to dissipate after those expiration dates. So they're not getting the nutrients that they need, that the parents are paying for, and also could potentially other types of health and welfare problems. We've seen this throughout the state. There have been numerous efforts to stop this practice through different legal tactics, and unfortunately, it simply hasn't stopped. We've seen that in other states, and we're seeing it here in California. I know the next witness will talk about that. Let me just add, it's so pervasive that you can go down to your local store and probably see this now. I did that a few weeks ago. I needed to get children's Claritin for my daughter and opened up the package, and the bottle was so brittle it almost just dissolved in my hands. Turned it upside down, and it was about 10 months expired, which means it's probably been sitting there for 2 or 3 years. So this is real. This is one way to create a disincentive from selling these products, and we ask for your support.
Other witness support?
Mr. Chairman, good afternoon, members of the committee. Lee Sandall with the International Longshore and Warehouse Union. The union feels it is important that consumers can be certain that the products they are purchasing are safe and effective. This legislation will prompt retailers to remove expired products by the sell date, ensuring consumers of the protection they deserve to have when purchasing these products. We ask for your aye vote.
Please.
Mr. Chairman, members, Dan Filosato on behalf of Los Angeles County District Attorney's Office. Tom Papageorge, my head deputy of our Consumer Protection Division, couldn't be here today, but he asked me to come and speak on his behalf. This is an important issue, consumer protection issue. As prior witnesses have stated, the selling of expired infant formula and OTCs over the counter can, in the most egregious situations, actually pose serious public health risks. Our office gets these referrals on a fairly frequent basis. and believe that this legislation is a step in the right direction. Recently, the Attorney General just settled a suit with a large retailer for selling expired infant formula, infant baby food. It's been a pervasive problem across the country, and we think California needs to do something on this.
Witnesses opposition?
Thank you, Mr. Chairman and Senators. Carrie Askew Bailey with the California Grocers Association. We are opposed to the bill. We have some specific concerns with several technical issues in the bill. I will first state that California Grocers, as a standard business practice, we do implement strict stock rotation practices. Stocking 50,000 items in your store, I would never claim that there is never a mistake and there never is a product that slips through that potentially is beyond the expiration date. Our method of dealing with that, you as a customer, bring it to our attention and we will make that situation right. I am unaware of any circumstance where a grocer in California has refused to exchange a product, fully refund money, if a consumer is dissatisfied with that product for any reason. Some of the technical issues with the bill that are of most concern to us is that there is no provision in the bill, even as proposed to be amended today, that would require any sort of substantiation. I'm unclear on how the whole fine situation would work. If I, as a consumer, could call the public health department, call the local police, I'm just not entirely sure how this is going to work. But there is no substantiation. So anyone could make a claim that on any date they purchased any product that had an expiration date of anything, and somehow we're supposed to then be liable for a fine. So that's a huge concern for us. There's a few other technical issues with the bill. I know the retailers are here as well, so we just request a no vote.
Thank you.
Missy Johnson on behalf of the California Retailers Association. We are opposed to the bill because of these technical issues, but I'm confident that we'll be able to work with Assemblyman Liu to work on those issues. I'd like to thank the committee staff for the analysis as well. Thank you.
Thank you. Someone, do you want to respond?
Sure. I'm more than happy to continue working with stakeholders. I believe we just took an amendment to require a receipt, which would actually show the date of sale.
Okay. Will the committee, questions committee?
Should I clarify?
I'm sorry, I didn't hear that last question, but have you responded to the concern with regard to the lack of need for the receipt?
I think we just took the amendment to require a receipt.
Very good, thanks.
Through the chair, if I may clarify, the proposed amendments do not include that language, but we have had discussions with the committee and also with the opponents that we are willing to take that language, work on it, including receipt or any other evidence that would be necessary for a consumer. So we will take those amendments moving forward.
And as a point of clarification, once those amendments are in print, the retailers will no longer be in opposition.
Okay. Will the committee? Senator Negrete McLeod moves the bill. Secretary, call the roll.
Senator Alquist, Strickland, Onnested, Cedillo, Cox, DeSaulnier. Aye. DeSaulnier, aye. Leno.
Aye.
Leno, aye. Maldonado. Aye. Maldonado, aye. Negrete McLeod. Aye. Negrete McLeod, aye. Pavley. Pavley, aye. Woke.
That bill has 5 votes, remains on call. Thanks, Assemblyman. Is it? Assemblyman Hernandez, you're up next. File item 15, members, AB 657.
Thank you, Mr. Chair and members. As you know, here in the state of California, I believe we have a healthcare crisis. But my opinion, and the reason why we're in a crisis, is because we have a workforce shortage. And if you look at the crisis that we have, it's such that we have the communities of color, which is predominantly African American and Latino communities, that have the highest incidences of chronic diseases, but yet have the absolute least number of per patient per capita in these particular communities. On the flip side, you have more affluent communities that have actually per capita more doctors per patient, and also in private insurance, as opposed to these communities of color that are on Medi-Cal. The problem is that in the state of California, you have two of the biggest cost drivers, which is chronic disease and, of course, end of life. And in order to solve our healthcare crisis, we have to do so by making sure that we have the proper number of healthcare providers to go to the communities that that needs the health care the most. So what my bill is going to address is the healthcare workforce shortage, which is here in the state of California, to make sure that all those needs are appropriately addressed. But it's not just the urban areas or the communities of color, it's also the more rural areas that also have a tendency to have least amount of providers to go and have the access problems the most. So what this bill does, AB 657, it'll create a task force to develop a master plan for California's health workforce professions. Under the bill, the Office of Statewide Health Planning Development, OSHPD, in collaboration with California Workforce Investment Board, would convene a task force with representatives from key stakeholders, including education, K through 12, higher education, industry, labor, consumers, regional leadership, to create a comprehensive plan for California's workforce, including allied health professions. So I'm here with some individuals who would like to speak on behalf of the bill, and I respectfully ask for your aye vote.
Witnesses in support.
Mr. Chairman, members, Tom Riley with the California Academy of Family Physicians, co-sponsors of the bill. This is an extremely important issue as we enter an era, hopefully, of healthcare reform. We are flying blind as a state in terms of the underpinnings of what will allow healthcare reform to go forward, or even what will allow adequate healthcare to be delivered to the most needy in the state. Roughly 1 in 8 Californians lives in a health professional shortage area. They may have health insurance, but they may not be able to get access to a primary care physician or other healthcare providers. What this does is to say we have some excellent legislation from the recent past that will create a healthcare clearinghouse. In other words, we will have information on the health professions available for people to look at it and scratch the surface of it and think about it. But there is no formal process that the state engages in to take that data and then say, this is where we need to go if we're going to make this work properly. That's what this bill does, and we urge your support.
Other witnesses in support?
Chad Silva, Latino Coalition for a Healthy California. We're sponsors of the bill. I'd like to echo what our co-sponsor said. While there are requirements that were created by SB 139 Scott for the Workforce Clearinghouse, there is no clear goal or focus for collecting the data. What this does is really give focus to that, and it says as long as we're going to engage in this, and as long as we're going to store the data, and as long as we're going to keep an eye on this, we need to come up with a comprehensive plan to address the workforce shortages. Also, it gets all of the relevant stakeholders in conversation with each other so that we can really get to a conclusion and get to an ultimate satisfaction of the problem. Just an example, Carrillo College in Aptos has a 4-year waiting list for their nursing program, and it is hopeful that through conversations with the various stakeholders that things like that will be remedied, because it's apparent that there are people who want to get into the workforce professions, the health professions, but are unable to because there isn't a conversation going on and all these various entities are siloed. So that's really what we'd like to address, and that's really what this bill needs to address, and it's very important that we do so. So I urge your aye vote.
Other witnesses for identification purposes?
Beth Capel, in this case on behalf of the Service Employees International Union, also in support.
Thank you.
Allison Ramey on behalf of the California Primary Care Association, representing over 800 community clinics and health centers, with over 60% of our clinics acknowledging a difficult time or shortage hiring physicians and other health workers. We strongly support this legislation.
Tom Peterson, Association of California Health Care Districts, in strong support.
Denny Bates on behalf of California Association of Regional Occupational Centers and Programs, also in support.
Thank you. Any witnesses in opposition?
Thank you. Good afternoon. I'm Lisa Douglas. I represent the Association of Independent California Colleges and Universities throughout California. We are in a position of oppose unless amended. The reason being our members that are the 75 WASC accredited degree granting institutions.
Please
yes,
pull it.
thank you. Provide to the state 38% of the nurses, 81% of the pharmacists and physicians. And it's our understanding the way the bill is currently written that there are representatives from the UC system, CSU, and the community colleges. And what we're asking is just to have an AICC representative as part of the proposed task force.
Mr. Hernandez, through the chair, would you agree to add private colleges and or universities as a member of your task force?
You know, this bill has been in the making for probably the last, well, this year, the last legislative cycle, and there's been plenty of opportunity for the individuals to come before and ask to be added. At this point, I'd like to just move the bill as is. I'd be more than happy to work with the opposition, look at when we can bring it in, maybe amend it in appropriations, but I don't think we've actually sat down and had the opportunity to look at what they can bring to the table. But I'm open to working with them.
Great, and we will continue to work with the author, too. We'd like to.
I'm prepared to support your bill today from my vantage point, but I want to be certain that the private universities and colleges are included in this task force. There should be no reason why.
No, I'm not disagreeing. It just I personally haven't had a chance to sit down and have this discussion, and I'm not saying that they aren't an integral part. Just have to make sure that the dynamics of the task force isn't going to be out of imbalance at all, because they do bring a lot to the table. Because there's a lot of private universities that she mentioned that do provide a lot of healthcare providers at all levels. But I definitely will take the task to make sure that we sit down and talk.
Senator Pavley?
I would like to go on record in supporting that request on the private institutions. My daughter happens to be in a physician assistant program at a master's degree level. Most of them are only available in private colleges, and they are instrumental in the future for providing needed support in underserved communities and urban areas as well as rural areas. I think you're going to see more and more physicians assistants sort of bridging that gap, if you will. Right. And so right now, if you go around and look online on what colleges, what's available as far as being a PA, it's mostly private, and they probably should, since it's just a task force, be part of the discussion.
I'd be more than happy to discuss it with them.
Mr. Chairman, I would move the bill with the understanding that Assemblyman Hernandez is going to look at the independent private independent universities and colleges in terms of adding them to the task force. You can take that amendment in appropriations or someplace else, but it's important that we have that.
Assemblyman, I wasn't going to vote for the bill, but I would like to go on record. I'll support the bill, but I have that same concern, and hopefully you could address that concern in
Fair
approach.
enough. And you have my word that I will work with them and make sure that we can resolve our differences.
Senator Leno, do you have a question?
I do. How is this not duplicative of the existing California Healthcare Workforce Policy Commission?
Well, go ahead. I'll let you take a first crack at it.
It really is the next logical step to the work that has been done already that remains without a product. Essentially, there is no master plan that has come out of that work. So what we are hoping is that takes it to that level.
So given we're in fiscal crisis, if not fiscal meltdown, why would we not take the existing commission that we have and continue the work there as opposed to establishing a whole brand new task force?
Thank you. The kind of what has not been said here, and it's apropos to the discussion that we just had, is that the funding for this would come from outside sources. And my guess is to continue the work of the commission, we would need to find outside sources as well to finish that effort. What the only general discussions we've had with outside sources has been to keep it simple, keep it small, focus on product, and don't let this expand outward to include large undertakings that that can't be funded. And I think that was both the concern in terms of creating this task force and keeping it simple and not having it ultimately be hundreds of members that we would welcome in our task force if we could possibly afford it, but also in having some funding source to continue the work that was begun already by the task force.
By the Commission?
By the Commission,
By
yes.
the Commission. Remind me how many people are on the Commission?
The Commission, I don't remember. I served on it, and it was a large table full of people.
But getting back to the desire to keep it simple, and that whether the Commission does the work or a brand new task force does the work, you need outside money. You haven't given me a good reason yet why that outside money couldn't be used to the ongoing work of the Commission.
With the author's permission, it could. This is entirely consistent, and it could be essentially the continued work of that Commission.
But why can't the Commission do it?
Because the Commission was created, and the Commission was the work of the Commission was ended, and we, in fact, one of the recommendations of the Commission was that it become this. That was not supported by the administration.
When did the Commission last meet?
Actually, Senator Leno, the Commission finished its work approximately a year and a half ago, and from its recommendation was to do a strategic plan. And I believe we're talking about SB 139, the Scott bill, which is predominantly a lot of data collection. But now you have data, now we have to realize what we're going to do and how we're going to utilize this data. And with regard to this particular piece of legislation, this is actually a master plan to look at a strategic plan, what we're going to do and move forward in the future.
Okay. I'm going to be thinking about that as I go off to present a bill, and I will be back. Thank you.
Sure.
Thank you. Any other questions from the members? The bill's been moved by Senator Cox. Secretary, please call the roll.
Senator Alquist. Strickland. Strickland, I. Onnested. Cedillo. Cox.
Aye.
Cox, I. DeSaulnier. DeSaulnier, I. Leno. Maldonado. Maldonado, I. Negretti McLeod. Negretti McLeod, I. Pavley. Woke.
That bill has 5 votes and will remain on call.
Thank you, Mr. Chair.
Next bill, file item 19, AB 818. Assemblyman, my understanding is there's support on both sides. I'd like to move the bill now, just so you know ahead of time.
Okay. I respectfully ask for your aye vote with amendments.
With amendments.
Catherine Austin Scott, representing Hespera, generic pharmaceutical company. My other client. This bill will allow, this was related to connectors on one of the most commonly used devices in the hospital. This bill will allow the U.S. FDA, along with the ISO and the WHO, to develop standards utilized in hospitals to streamline the utilization of those products. We ask for your support.
Thank you. Go ahead.
Hi, good afternoon. Chris Rosa representing AdvaMed. AdvaMed supports the creation of new small bore connectors that can't be mistakenly interchanged by healthcare providers. This bill allows for the necessary standards and to be developed and the products to be manufactured in the best way for patients and hospitals in the state.
My understanding, no opposition to this bill. That's correct. Secretary, call the roll.
Senator Alquist. Strickland. Aye. Strickland, I. Onnested. Cedillo. Cox.
Aye.
Cox, I. DeSaulnier. Leno. Maldonado. Maldonado, I. Negretti McLeod. Pavley. Pavley, I. Woke.
That bill has 4 aye votes and will remain on call, Assemblyman.
Thank you, Mr. Chair and members.
Thank you.
Good afternoon.
Assemblyman Hill, I believe you're next. Assemblyman has file item 25, AB 1397. Please, Assemblyman.
Thank you, Mr. Chair and Senators. I wanted to begin by thanking the Chair and her staff for working so diligently with my office in crafting the policy before you. As a result of ongoing negotiations with the committee, I would like to author amendments to address the concerns raised in the analysis. I can go over those amendments, but we do accept them. But AB 1397 is a cleanup measure to a bill that was passed 2 years ago. The bill before you would allow HIV discordant families to have biological children while protecting the health of both the mother and child. With the advances in medical technology, HIV is now considered a chronic and manageable disease. Many HIV-infected adults that responsibly adhere to their treatments have near normal life expectancy with typical life goals such as starting a family. In order to minimize the risk that an uninfected partner and future children of an HIV-positive person could be infected, artificial insemination must be used in conjunction with sperm processing and testing. Sperm washing can separate healthy sperm from the other components in semen that may contain HIV, removing 99.9% of HIV particles. Until 2007, California law prohibited the use of sperm from a man infected with HIV or HTLV, once properly processed, from being used in assisted reproductive technologies. SB 443 in 2007 sought to correct the situation. With the passage of SB 443, the state was on its way to helping people begin families and without restoring to leaving the state for care, or more disturbingly, attempting to conception through natural methods, which would put the woman and baby at risk for infection. So once the law began to be implemented in the field, problems in the language were discovered. SB 443 was unclear about which medical professionals were responsible for the care of HIV or HTLV.
Assemblyman, I believe there's support on both sides on this.
There is.
So
There has been, Mr. Chair, there has been.
No opposition. So I'd like to move the bill as amended.
Thank you very much, sir.
Shannon Smith Crowley, representing the American Society for Reproductive Medicine. I actually was here to handle the technical issues, but I think that's been handled quite well. Again, this is a cleanup bill, and we are putting the urgency clause in because for women in their 30s, that egg production dramatically decreases at age 30 and 35, and defects in eggs rise quickly. So even a few months difference in getting this bill implemented makes a difference in whether a couple can achieve a pregnancy. We ask for your support.
And I understand there's no opposition, and so the bill's been moved. Secretary, please call the roll.
Senator Alquist. Strickland. Aye. Strickland, aye. Honested. Cedillo. Cox.
Aye.
I'm sorry, Cox.
Aye.
Cox, aye. DeSaulnier.
This is
Leno.
number 25.
Maldonado. Negretti McLeod. Negretti McLeod, aye. Pavley. Aye. Pavley, aye. Woke.
Honested, aye.
Honested, aye.
That's 5 aye votes, Assemblyman. Will remain on call for other members to come.
Thank you, Mr. Chair. Thank you, Senators. Appreciate the support.
I believe we have no other authors, so if we can call the offices just to make sure. Madam Secretary, can we open the rolls for members, since we're waiting for authors? Can we open the rolls for absent members? Never mind. Never mind. Assemblyman Jones, you're up. File item 24 AB 1383. Thank you, Assemblyman.
Welcome.
Thank you. Thank you very much, Mr. Chair and Madam Chair. Madam Chair, Senators, thank you for the opportunity to present AB 1383, which is jointly sponsored by the California Hospital Association, the Daughters of Charity,
And this is file item 24. Okay.
and the California Children's Hospital Association. Very much like the bill that this committee took up earlier this afternoon, AB 511, which was a provider fee for
ambulances. This bill is a provider fee for hospitals. All of you are undoubtedly far too aware of the plight of hospitals in your own districts and throughout the state of California who are facing, many of which are facing financial disaster. In large measure, those hospitals which see a lot of Medi-Cal patients are not being sufficiently reimbursed for doing so, and as a consequence find themselves oftentimes on the brink of going under. This bill is the first of a two-bill strategy to address that problem and to enable us to bring in between $3 and $4 billion in enhanced federal Medicaid funding for our desperately needed hospitals. This is the first of those two bills, and what it does is it lays the architecture for a second bill that will establish the details for the provider fee. The reason for this two-bill approach is that we've been advised by our experts, including a person who very recently worked at the Center for Medicaid and Medicare Services at the federal government, which is the federal agency that would have to decide whether we could move forward with this approach, that in order to best position the state of California to maximize the amount of federal funding available under the federal economic stimulus measure that was recently passed, in order to make sure we have the best chance of pulling down enhanced federal Medicaid dollars for the third and fourth federal fiscal quarter, we need to move now to enact a measure that the federal government can then look to with assurance to say, yes, the state is moving forward with a provider fee. And so that's why we're moving forward with this bill today as an urgency measure to enable us to be in the best position with the federal government to pull down those dollars as soon as possible. And as I mentioned, the second bill would lay out in further detail the fee details to determine who does and does not pay the fee and how the new funding will be allocated. And the hospital community, under the leadership of the California Hospital Association, is working on the details of that right now. I know that recently there have been some concerns raised about whether the bill is a fee or a tax. We've consulted with Legislative Counsel. They have drafted additional language that reinforces that this is a fee, much as was the case for the bill that you heard earlier today. And we are happy to take those amendments in the Appropriations Committee. Due to the necessities of time, the chair has suggested that we do it that way, and we're very happy to accede to that request. So we do have some witnesses who'd like to speak on behalf of the bill.
Yes, and we are limited to 2 witnesses, 2 minutes each, and then others just to say they are in support.
Very good. Well, if I could introduce...
Excuse me, Senator Strickland.
I just want to comment on that one point. I've committed not to vote for a tax increase, and I can't vote for this bill today until I see the language, until it is strictly put in as a fee. I just want to make that clear, and I think you already know that as some of that.
That's very fair, Senator. And we can pass the language out now. We have it, if that would help. And you have my commitment to take that language.
I think
it wouldn't help for my vote today because I just need to look at it and we need to analyze it. But I do want to let the record show that, I'm not going to vote for a tax. But if it's characterized as a fee, I would be a lot more supportive.
Okay.
Thank you. We do understand, and when it is really in writing, then Senator Strickland can decide what he chooses to do. So 2 witnesses, 2 minutes each.
Thank you, Madam Chairman. I'm Dwayne Donner, President of the California Hospital Association and one of the co-sponsors. Why do we need a bill like this? Medi-Cal is the worst paying Medicaid program in the country and has been for several years. Last year, California hospitals lost $4 billion treating Medi-Cal patients. The cost that we incurred that wasn't paid for was $4 billion. That has doubled in the last 4 years from $2 billion. Medi-Cal was bad, and it's getting dramatically worse. The hospitals have no place to go to cover that. We've been charging the privately insured patients. Hospitals get grants, bequeaths, and other sources of income to try to cover those losses, but we're running out of options. With the increased federal match that the Assemblyman mentioned, we can take advantage of the last 2 quarters of this current federal fiscal year and all of the year next year through December. We believe that this is an opportunity to move the ball forward. There is a need for a second bill, as our author has articulated, because we do not yet have a consensus within the hospital community. CHA is working diligently with all the membership to try to find common ground so that we can have a consensus. Roughly a third of our members currently are opposed to it, and the CHA board has said continue to move forward with the two-bill strategy, but work to come up with a consensus among the members so the board can, in fact, take action on a proposal that represents the true feelings of the entire membership. We will not bring forth a recommendation to Mr. Jones unless there is a consensus, so that the hospitals can be assured, all of our members, that we are not going to do something that will be disadvantageous. One of our problems is we have numerous federal regulations we have to comply with, and there are other limitations on what you can and can't do in a fee proposal. And consequently, we're trying to balance all of those together with the interests of our membership. And we know that that this is a challenging time. We also realize that this committee is buying the first bill on the basis that we will come forward with something, and we commit to do our best to try to achieve that goal. Thank you.
Other witnesses in support? It's 2 and 2.
Thank you, Senator. I'm Diana Dooley, President of the California Children's Hospital Association. We are proud to be a co-sponsor of this for all of the reasons that Mr. Donner has well articulated. Children's hospitals have the highest concentration of Medi-Cal, and as the Medi-Cal rates fall further behind, that concentration increases and our capacity is insufficient. More and more community hospitals are closing their pediatric beds, and in Medicaid generally in California, there are fewer and fewer providers. If we don't address the fundamental issues of Medicaid reimbursement, care is not going to be limited just for the safety net or threatened just for the safety net. It adversely impacts everyone's care when they need hospitalized care. So it is very important that we move forward. This bill is essential to maximizing the amount of federal money that can come to California, but we have to do our part, and I plead with you to support this bill today. Thank you.
Thank you. Other witnesses for identification purposes?
Mr. Chairman, Conway Collis with Daughters of Charity Health System. We're a co-sponsor of the bill. Our mission is service to low-income and indigent, and this bill is life and death for our hospitals and the patients we serve. We urge an aye vote.
Thank you.
Thank you.
Mr. Chairman and members of the committee, Nathan Mansky representing the Private Essential Access Community Hospitals, a coalition of private safety net hospitals in California, Adventist Health, which operates 14 hospitals in California, and Loma Linda University Medical Center. Thank you.
Thank you.
Mr. Chair, Terry Calgar Hill on behalf of the 100% campaign in Pico, California. We are grateful that this measure also includes funding for children's health care coverage, $320 million a year, and we are in strong support of this bill and thank our hospital partners.
Thank you.
Kathy Mossberg, representing the local health plans of California, in strong support. Thank you. We urge your aye vote.
Thank you.
Terry Thomas on behalf of the California Association of Public Hospitals and Health Systems. Our 19-member hospitals provide over one-third of all the care to Medi-Cal and over half of the care to all the uninsured in California. And we definitely support the principles outlined in this bill and urge your support.
Thank you.
Mr. Chair and members, Beth Capel on behalf of Health Access California. We are, I believe, alone in the supportive amended category, so wanted to get up here before the opposition arrived. We are in a supportive amended on this bill. We agree that Medi-Cal rates for hospital reimbursement are not adequate. This was one of the elements that we supported in health reform. We are, however, disappointed on several scores. We wish first that more of the resources here were devoted to expanding coverage. We also would prefer that we undo some of the cuts to Medi-Cal that have already occurred, including the elimination of adult dental, which is a permissible use of these funds. We further take note that as we look to the federal level where there's discussion of health reform, in every proposal there's an expansion of Medi-Cal, in most instances to 133% of poverty or 150% of poverty. given our difficulty in funding our existing Medi-Cal program, we literally have no idea where we will find the resources to put the money on the table to do California's share if health reform occurs at the national level. And for those reasons, we are in a supportive amended position. I do want to affirm again, having raised those concerns, that we do recognize that hospital reimbursement is not adequate, but in reform, a greater share of the hospital provider fee went towards expanding coverage, and given the cuts that have happened since 2007, we would hope that some of those would be restored.
Catherine Austin Scott, representing the United Hospital Association, flipping back to the support category. Thank you.
Good afternoon. Clara Evans with Catholic Healthcare West. As the largest private provider of Medi-Cal services in California, CH...
State that you are
I'm sorry,
in support.
in support. Thank
you. Anyone else in support? I have a question if the administration would come up, please. Is anyone here from the administration? I think this is a question, welcome, a question that's on a lot of people's minds, and that is, can you give us any details about what the governor is asking for in terms of the provider fee? For example, how much will be taken by the state, and what will it be used for? And if you do not have any details, do you know when they might be forthcoming?
Good afternoon, Senators. My name is Katie Trueworthy. I'm with the Department of Health Care Services, and I want to thank you for inviting me today. We do not have an official position on this bill, but I do just want to say that we have been working as much as we can with the author's staff as well as the committee staff to identify some technical concerns that we do have with the bill. So I'm here to answer any questions, and I will get to your question as well. But I wanted to, if there are any technical questions, I'm here. I'll try to address those. As you know, the governor has proposed doing a broad, comprehensive hospital provider fee. We started doing this back with health care reform, and recently the governor also announced encouragement of doing an additional hospital provider fee. Right now on the table we have put out doing a 5% provider fee. During health care reform we had talked about a 4%. What it would be used for is basically to the overall general fund and Medi-Cal program. As folks have said, the Medi-Cal reimbursement system is adequately very low. We are always looking for ways to increase provider fees, and we think that the provider fee structure that CMS and the feds allow is an appropriate way to do so.
Thank you. Are there any questions for the administration? Okay, thank you very much. Opposition?
Thank you, Madam Chair. Bill Worley with Kaiser Permanente. Regrettably, we are here in opposition to this measure, not because we have a fundamental problem with the concept of a hospital fee or, from what we have seen of Ledge Council, attacks. Indeed, in healthcare reform, our organization signed up for a fee that would cost us something in the neighborhood of $120 to $180 million a year. And we stood by the Speaker and the Governor every step of the way in every committee hearing pushing for that comprehensive proposal to bring health care to 4 million Californians into being, despite the fact that it would come at that kind of cost. Here, unfortunately, we have a proposal that says there shall be a tax, and we'll tell you what it is later. Just yesterday, we saw models prepared by the sponsors that had the hit to Kaiser Permanente families at $37 million a year to $117 million a year. And indeed, that does not allow for the higher amount that the administration might like to see as part of the tax. We don't know if it fully covers what the public hospitals are seeing and so forth. We simply cannot agree to pay a fee, pass the bill, lose all of our leverage, candidly, have the money scored in the budget, and then try to negotiate the details later. Indeed, we can't think of a single time for any industry when this legislature has singled people out for a tax, passed the tax, and said, we'll tell you the amount later. If we're going to get to a place where this proposal is going to work, we can bring the additional monies into California for the hospital community and for to support the Medi-Cal program, which we know direly needs the funds. We have to get to a point where there is consensus. And with all due candor, or all due respect and candor, I don't know that we are on that path. Instead, we see this bill being pushed over our objections. We don't see negotiations taking place. We see amendments at the last minute. And we're left in a position where we have to do everything we can to oppose the bill. And I don't know how that changes unless we all get in a room and start negotiating. And for that reason, we're in opposition today.
Thank you.
Madam Chairman, I'm Michael Barden with Scripps Health in San Diego. And AB 1383 does establish a tax on hospitals, but all these details are deferred till later. All this under the pressure of fast-tracking it, calling it an urgent measure. If it was so urgent, why don't we have all the details? Why haven't we reached them? We don't have them because try as we will, and we have for 6 months now, we haven't come close to a fair and equitable solution. The only solutions we've tried are greatly upset the market. They reward some in excess. They harm others inappropriately. You just heard. They threaten to result in unconscionable consequences within the hospital community. And this lack of surety and the potential harm, this bill says, let's go ahead and approve the tax anyway. We'll work out the details later. There is no urgency that can justify putting this proverbial cart before the horse. How can Scripps Health and any of our colleague hospitals support a bill that imposes a tax, and make no mistake, this is a tax, without seeing any of the provisions of how the final tax provision will work? Bad as the Medi-Cal system may be, this is no way to fix it. So AB 1383 it should be held until we have, at least until we have the entire package in print and all the affected parties can know specifically how it's going to deal with it, and then we ought to proceed.
Thank you. Others, if they would just state their name and that they're in opposition.
Okay. Madam Chair, Tom Bone on behalf of Sutter Health. Is it possible to just make one point on the CMS issue, because it hasn't been raised? It was raised by the proponents, but not by the opponents. It's very quick.
Of course, you may have 30 seconds, but in the future you need to decide ahead of time. And
I appreciate that. I had hoped that it would have been brought up. My only point that I would add to this, and we are in opposition to the bill for the reasons that have been stated, but on the CMS point, the point has been made that we need to pass this bill right now because we need to establish in statute that there's going to be this tax or fee or whatever we're calling it today. The fact of the matter is CMS is going to want to know a whole lot more about what that is, how the tax is going to be assessed, how much, who's it going to go to, how's it going to be distributed. That's much more important to them than simply establishing the fee or the tax. So having that second bill pending for some period of time, but passing this first makes absolutely no sense when CMS is absolutely going to want all that information. Thank you very much for your consideration.
Fred Main on behalf of Cedars-Sinai Medical Center. We're opposed for the reasons that have been stated.
Thank you. Is there any other opposition? Comments from the committee? Senator Cox.
Madam Chair, I just wanted to ask one question. I note in our analysis that it says there's a concern that this bill would have a harmful impact on the negotiations for the state's hospital waiver, which is the current Medicare hospital uninsured care, which expires in 2010. And I'm wondering if there's any of these gentlemen who could answer that question.
Can the author hazard an answer and then defer to the other witnesses? Okay. We've taken language, Senator, directed at that issue that makes clear that once the negotiations with CMS commence, that they need to be done mindful of the relationship to the waiver. And we took that language at the request of the public hospitals and with the approval of the rest of the sponsors, precisely because there was that concern about the relationship between the two. The difficulty, though, is if we wait to do this until the waiver discussions are completed, the waiver doesn't expire until the end of 2010, and we will forego literally, potentially billions of dollars of federal Medicaid funding. And so that's the urgency of doing this now. But there is language in the bill that makes clear that the two need to be done in relation to each other.
Has the administration taken steps that would preserve the state's ability to bring in a federal fund should a consensus be achieved?
We did ask, and the administration did file a state plan amendment.
And the administration can speak on that point.
And I think where we continue to have a concern, though, is that although that state plan amendment meets the minimal legal prerequisite for initiating the amendment, what we've been advised by experts who used to work at CMS and continue to have relationships there is that that alone won't best position the state of California. We've got to be able to point to some action, even though not final, that puts the architecture of the revenue stream in place that we're relying upon to request the feds then to match the federal dollars. And that's essentially the conundrum and why we're moving this bill and why it's linked to a second bill that would also need to be enacted this year. And all of this fee is contingent on that second bill. And so all of the concerns that have been raised by the opposition about we're concerned that something's going to be imposed on us, we're not going to see it. The second bill, if it's not enacted, if it doesn't have their support and it's not enacted, then there is no fee.
Thank you, Assemblyman. And I'd like the administration to speak to the point.
Thank you very much. Katie Truworthy with the Department of Health Care Services. I'm not going to say that I disagree with what the Assembly member said or at all with what his consultants have said, but we firmly believe that we submitted a SPA, we've met the public requirement notice, and that will give us the ability to be able to claim back up until April, the second quarter of this year. We believe that CMS will require one bill that has all the facts. I think I would like to go on record as saying the administration is not supportive of a two-bill approach. We do not see the need for that. We believe we have met the goals of what the first bill is trying to do. We understand that there is a policy decision for the first bill, and we completely do not have a position on that, but in terms of CMS and what our responsibilities are of meeting the public notice and submitting a SPA, we believe we have met those requirements.
Thank you. Are there other questions?
Thank you, Madam Chair.
You're quite welcome, Senator Cox. Assemblyman Jones, I think you've covered most of the topic. Do you have any brief comments to make in a close?
Well, only that CMS has said that the state plan amendment or SPA cannot be approved. It's not complete until we've actually taken some step to enact a fee. And while, as I said a moment ago, submitting the state plan amendment meets the narrow legal requirement, it does not, and with respect to the administration, they have not produced an expert or a contact from CMS that would tell us that this bill is not needed to best position the state of California to pull down those dollars. So I'm very risk averse when it comes to the health of our hospitals. I mean, we pick up our paper each and every week and we read about some hospital that's back is up against the wall because the Medi-Cal reimbursement is not sufficient. I think we need to do everything within our power to undo the wrong that, frankly, the federal government has done to us for decades by keeping us at a low federal reimbursement level. This bill gives us a chance to do that, at the same time protecting the position of the opponents, because the fee doesn't happen unless the second bill is enacted. That bill will require a 2/3 vote. It'll be done on an urgency, and you have my commitment that we're not going to run anyone over. But we do need to do this now to maximize our ability to pull down the dollars in the third and fourth quarter. And Madam Chair, I want to thank you personally. I know you've given a lot of attention to this, and you've suggested a number of amendments that I was happy to take to streamline this. And I want to thank you and your staff for all of your work on it.
You have worked very hard on this also, and I appreciate it. And I know it's probably still a work in progress, and I'm sure you got a lot of good input today. So is there a motion on the bill? I'll move the bill. Call for the vote.
Senator Alquist?
Aye.
Alquist, aye. Strickland? Onnested? No. Onnested, no. Cedillo? Aye. Cedillo, aye. Cox? No. Cox, no. DeSaulnier? Leno? Maldonado? Negretti-McLeod? No. Negretti-McLeod, no. Pavley? Woke? It's got 2 votes.
The bill has 2 votes and will remain on call. Assemblyman, you have another item, file item 29, AB 1521.
Yes.
Would you like to present?
Mr. Chairman, Senators, this bill deals with the issue of the sort of disclosures and rules that would apply to brokers who are selling health insurance and participation in health plans. The bill has a number of features in it that are designed to try to protect consumers, to make sure that the compensation regimes for brokers and agents aren't designed in a way that would result in incentivizing a behavior that would inure to the disbenefit of consumers. We worked very closely with the industry to take a series of amendments, and we're very pleased to take as authors amendments those listed in the committee analysis. And I want to thank the chair and the staff of the committee for working so closely with us on this, as well as the insurer and broker organizations who have very helpfully suggested amendments as the bill has moved along. There is no opposition to the bill, and we would ask for your aye vote.
Witnesses in support?
Beth Capel on behalf of Health Access California. We are the sponsors of this measure. We have sponsored this measure because there has been experience in other states where brokers are paid additional compensation based on the risk status or the health status of the persons to whom they sell. And in addition, brokers are sometimes paid a higher compensation when somebody changes products with the same carrier. We were pleased as we've worked with the brokers and the insurers to find that what we are doing in this bill is to codify what is existing practice in California. And I would pleased to say this is one of those rare opportunities where rather than attempting to correct bad practices, we're preventing them before they occur and codifying what is good practice in the industry now.
Thank you. Witnesses in support? Oh, okay. Never mind. No witnesses opposition. Will of the committee or questions? Senator Negrete McLeod moves the bill. Secretary, please call the roll.
Senator Alquist. Strickland. Strickland, no. Onnested. Onnested, no. Cedillo. Cedillo, aye. Cox. Cox, no. DeSaulnier. Leno. Maldonado. Negrete McLeod. Negrete McLeod, aye. Pavley. Woke.
That bill has 2 aye votes. Assemblyman, it will remain on call. Assemblyman, I do believe you have a Health Committee bill, file item 30, AB 1540.
I do, Mr. Chair. Senators, this is the annual Health Committee cleanup bill. Makes a number of technical and non-controversial changes to various health programs and statutes. We have folks here to answer any questions the committee might have.
Bill's been moved by Senator Onnested. I believe this is supportable on both sides, but please.
Katie Truworthy, Department of Health Care Services, here to answer any questions that the members might have. Thank you.
Linda Patterson, California Health and Human Services Agency.
Any witness opposition? Or no? Support? Go ahead. You can run. I got a quick stop there.
Tough to do in heels, too.
She was running fast.
Sherry Lowenstein with the Department of Managed Healthcare. Hey, we actually get a supporter bill. Just want to mention that we're here for questions and also to reference that we're supportive of the positions that allow us to change the consumer notices for readability and accuracy.
Thank you. This bill has been moved by Senator Onnested. Secretary, please call the roll.
Senator Alquist. Strickland.
Aye.
Strickland, aye. Onnested. Aye. Onnested, aye. Cedillo. Aye. Cedillo, aye. Cox. DeSaulnier. Leno. Maldonado. Negrete McLeod. Negrete McLeod, aye. Pavley. Woke. 4 aye votes.
That bill has 4 aye votes. Remain on call. Thanks, Assemblyman.
Thank you, Mr. Chairman.
Assemblyman Duvall, I believe you're up next. Assemblyman Duvall has file item 22, AB 1100.
Thank you, Mr. Chair and members. I'm going to get my witnesses up here. I'll go ahead and start. I want to thank you for giving me the opportunity to present the bill today. AB 1100 is a prudent bill that will allow limited bottling of highly treated recycled water for educational purposes. I really believe California needs to...
Assemblyman, I believe this does have support on both sides. Just let you know ahead of time.
Okay.
Save some time.
Okay.
But Sam Annisted has a question, Senator Annisted. But do you want to wait?
Maybe in your comments you could address why not for sale? If it's so good and you can drink it, why not for sale?
Okay, let me just go ahead and answer that. This is, right now, Orange County has the groundwater replenishment system that we are so proud of. We're doing 70 million gallons a day, putting 35 million gallons back into the aquifers, another 35 million into the reverse pump wells to keep the salt water from retreating to groundwater. This bill is particularly just for educational purposes, because what we're going to do is we're going to bottle only 1,000 gallons a year, and I'm going around the state of California trying to promote how important it is that we recycle every drop of water we can. And so to put this into bottled water and sell it right now would just flip everybody out. That's not my intent. My intent here is to be able to go around the state and educate people about how important recycling water is. The bottom line is any drop of water that we can recycle is considered new water. And right now there's about 1,300,000,000 gallons a day going out to the ocean that we could be putting back into our aquifers and back into the source of water for new water.
Great. Witnesses like to say a few words or just say identification purposes?
Just a brief comment, if I may.
Sure.
Mike Wayner, Orange County Water District. We're sponsors of the bill. I'm sorry?
Hit your mic, the button.
Is it on now?
No. One more time.
It's right.
Pull it down to your mouth.
I'm sorry, too far away?
Yeah,
Sorry
there,
about
that's
that.
the problem.
I'm Mike Wayner, Orange County Water District. Orange County Water District is a sponsor of the bill. We're really pleased that Mike's shown such great enthusiasm for water recycling. We're pleased with Assembly Duvall's efforts to move forward with AB 1100 to try to really encourage the rest of the state of California. This isn't so much about California. It's really to help encourage the rest of the state of California to move forward with recycling projects like the groundwater replenishment system. I don't want to say too much about it because I don't want to take up a lot of your time. I know it's standing on a tight schedule. But all we're really proposing here is that the water be bottled for educational purposes. It's not for marketing. It's not for really for drinking water purposes so much as for tasting purposes. So people can get a sense that this isn't such an objectionable process, taking wastewater and turning it into drinking water. Right now today, with processes involving microfiltration, reverse osmosis, and advanced oxidation with UV and hydrogen peroxide, we're taking wastewater and turning it into the best available water for replenishing our groundwater system. We think that can be done all over the state of California, and we'd like to encourage a yes vote on the bill.
Okay. Next witness, please.
Robert Ennis with Orange County Water District. Here to answer any questions the committee might have.
Okay.
Thank you.
Thank you.
Rosie Thompson with the Metropolitan Water District of Southern California in support.
Thank you. Witnesses in opposition? Comments from the committee?
I'd like to move the bill.
The bill has been moved by Senator Strickland. A brief close, please.
I ask for an aye vote. Thank you very much.
Thank you. Call for the vote.
Senator Alquist?
Aye.
Alquist, aye. Strickland?
Aye.
Strickland, aye. Onnested? Onnested, aye. Cedillo? Cox?
Aye.
Cox, aye. DeSaulnier? Leno? Maldonado? Negretti McLeod? Aye. Negretti McLeod, aye. Pavley? Woke?
Sure.
It's got 5 aye votes.
That bill has 5 votes. We are putting all bills on call.
All right, thank you.
Thank you very much. I understand Assemblywoman Brownlee is here. This is the last bill. So after we do Assemblywoman Brownlee's bill, we will be lifting the roll on all the bills.
Yes, he was first.
Yes. Yes, so this is the last bill. It is 4:30. We will be doing the lifting, the final lifting of the votes at 4:40, approximately 4:40.
Thank you, Madam Chair.
And this is file 23, AB 1269.
1269, thank you. AB 1269 is a bill to encourage participation in the Medi-Cal Working Disabled program so more individuals with disabilities can work and save their earnings while keeping essential health care coverage. It primarily does this by, 1, allowing temporarily unemployed enrollees to remain in the program for up to 26 weeks during their work transition, And 2, letting enrollees keep their savings without limit in a separate account so they do not have to cut hours and decline promotional raises to stay within program income limits. The Working Disabled program is strongly supported by the disability community, employers, and state administration, and this bill reflects desired reforms to help even more individuals enjoy independent and productive lives. Access to health care should not be a hindrance for this underutilized workforce with great potential. Let's give Californians with disability the opportunity to thrive and not just to survive. And with that, I respectfully ask for your aye vote, and I have Burns Vic here representing, who is our sponsor, representing World Institute.
Thank you, and I understand
Disability.
there's no opposition on this bill.
That's correct, and about 80-something groups around the state
So
supporting
you
the
might
bill.
want to keep that in mind in your comments.
Thank you.
Go right ahead.
Burns Vic, on behalf of Brian McDonald and the World Institute on Disability. The analysis is very clear in laying out the policy issues. I believe some of you know that this the 4 remaining issues in 1269 were in fact approved by this committee in a bill last year, AB 851. So one of those 4 is in fact an amendment requested by the administration. So we have the Department of Healthcare Services supporting this. Hopefully when we get to appropriations, you all will find that the cost analysis is a very low cost analysis and impacts on the general fund and the Medi-Cal program. We urge your aye vote. Thank you.
Thank you, Madam Chair, members of the committee. Maureen O'Haron with AIDS Project Los Angeles in support.
Charlotte Newhart with the California Foundation for Independent Living Centers in support.
Beth Capel on behalf of Health Access California and SAIU also in support. Just to mention that there are benefits that persons with disabilities need that are not covered even by employment-based coverage, such as wheelchairs and so on, so that it's important that they have access, continue to have access to Medi-Cal.
Californians, Randy Hicks of Californians for Disability Rights. We concur.
Thank you.
Brandon Tartaglia with Disability Rights California. We support.
Thanks.
Kathy Mossberg, San Francisco AIDS Foundation in support.
Thank you. The bill has been moved by Senator Negrete McLeod. Were there any other comments? If not, call for the vote.
Senator Alquist?
Aye.
Alquist, aye. Strickland? No. Strickland, no. Onnested? Onnested, no. Cedillo? Aye. Cedillo, aye. Cox? Cox, no. DeSaulnier? Leno? Maldonado? Negrete McLeod? Negrete McLeod, aye. Pavley? Woke? Aye. Woke, aye. It's got 4 ayes. Maldonado, aye.
DeSaulnier, aye.
DeSaulnier, aye. It's got 6 now.
That bill has 6 votes, which is enough to get out. We are going to lift the final call any moment now.
Thank you, Madam Chair.
Thank you very much. Okay, what I'm going to do, members, is that for those of you who are here right now, and I do appreciate that, we will go through all the bills one time, and then so then you may leave. And then at 4:40, I will do the final roll. So we will go through everything twice. This is the first time. And the last time will be at 4:40.
First on the consent calendar?
Yes, consent calendar.
Senator Onnested? Aye. Onnested, aye. Cedillo? Aye. Cedillo, aye. DeSaulnier? Aye. DeSaulnier, aye. Maldonado? Aye. Maldonado, aye. Woke? Aye. Woke, aye. That's 11.
That has 11 votes. It's the consent calendar. Yeah, so the consent calendar is out.
Okay. Item number 2, AB 2 by Assemblymember De La Torre. On the motion, do pass to judice, amend in judice. Senator Onnested? Cedillo? Aye. Cedillo, aye. DeSaulnier? Aye. DeSaulnier, aye. Leno? Maldonado? No. Maldonado, no. Negrete McLeod? Negrete McLeod, no. Woke? Peter. Woke, aye. Okay, yes, okay. only has 5.
That has 5 votes, and of course, we're holding everything open 5 more minutes. Next one.
Okay. Item 4, AB 98, Assemblymember De La Torre, do pass to appropriations. Senator Alquist?
Aye.
Alquist, aye. Honested? No. Honested, no. Cedillo?
Aye.
Cedillo, aye. DeSaulnier?
Aye.
DeSaulnier, aye. Leno? Maldonado? Woke? Aye. Woke, aye. That's got 6 votes.
That has 6 votes.
Maldonado, no. Okay.
And is still on call.
Item number 5, AB 217 by Assemblymember Bell. On the motion, do pass to appropriations. Senator Honested? No. Honested, no. Cedillo?
Cedillo, aye.
Cedillo, aye. DeSaulnier?
Aye.
DeSaulnier, aye. Maldonado? Aye. Maldonado, aye. Woke? Aye. Woke, aye. 10.
That has 10 votes. We will keep it on call.
Item number 6, AB 221 by Assemblymember Portantino. On the motion, do pass to appropriations. Senator Alquist?
Aye.
Alquist, aye. Honested? Aye. Honested, aye. Cedillo? Cedillo, aye. DeSaulnier?
Aye.
DeSaulnier, aye. Leno? Woke? Aye. Woke, aye. It's got 9.
That has 9 votes. File item 8.
7.
File item 7.
Item 7, AB 303 by Assemblymember Bell. On the motion, do pass to appropriations. The chair voting aye. Senator Honested? Aye. Honested, aye. Cedillo? Aye. Cedillo, aye. DeSaulnier?
Aye.
DeSaulnier, aye. Maldonado? Aye. Maldonado, aye. Woke? Aye. Woke, aye. It's got 11.
That has 11 votes.
Item number 8, AB 359 by Assemblymember Nava. On the motion, do pass as amended to appropriations, with the chair voting aye. Senator Honested? Aye. Honested, aye. Cedillo? Aye. Cedillo, aye. DeSaulnier?
Aye.
DeSaulnier, aye. Maldonado? Aye. Maldonado, aye. Woke? Aye. Woke, aye. That has 11.
That has 11 votes.
Item number 9, AB 369 by Assemblymember Yamada. On the motion, do pass to appropriations, with the chair voting aye. Senator Honested? Aye. Honested, aye. Cedillo? DeSaulnier?
Aye.
DeSaulnier, aye. Maldonado? Maldonado, aye. Woke? Aye. Woke, aye.
Cedillo, aye.
Cedillo, aye. That's 11.
That has 11 votes.
Item number 10, AB 417 by Assemblymember Bell. On the motion, do pass as amended to appropriations. The chair voting aye. Senator Honested? Aye. Honested, aye. Cedillo? Aye. Cedillo, aye. DeSaulnier?
Aye.
DeSaulnier, aye. Maldonado? Maldonado, aye. Woke? Aye. Woke, aye. That's 11.
That has 11 votes.
Item number 11, AB 511 by Assemblymember De La Torre. On the motion, do pass as amended to appropriations. Senator Alquist?
Aye.
Alquist, aye. Honested? No. Honested, no. Cedillo? Aye. Cedillo, aye. DeSaulnier?
Aye.
DeSaulnier, aye. Leno? Maldonado? Aye. Maldonado, aye. Woke? Aye. Woke, aye. 9 votes.
That has 9 votes. And I'd like to make a comment on item 12 before we do the vote, and that is that really because I really believe we are going to be having a big earthquake at some point, and so I'm the Senate's representative to the Seismic Safety Commission. I don't look favorably on bills that just, give hospitals more time on retrofitting. So I will not be voting for this bill, but I do want to say I think this bill is worthy of others to vote for it, that it's an urgency measure, and I hope you're understanding what I'm saying. Okay, file item 12.
AB 523 by Assemblymember Huffman. Do pass as amended to appropriations. The chair abstains. Senator Honested? Honested, aye. Cedillo? DeSaulnier? Aye. DeSaulnier, aye. Maldonado? Maldonado, aye. Woke? Cedillo, aye. It's got 9.
That has 9 votes. File item 13.
AB 543 by Assemblymember Hall. On the motion, do pass to appropriate. What did I say?
You said Hall, but you mean Ma? It's file item 13.
File item 13, yeah. I'm sorry.
That's okay.
On the motion, do pass to appropriations. Senator Alquist?
Aye.
Alquist, aye. Honested? No. Honested, no. Cedillo? Aye. Cedillo, aye. Cox? Aye. Cox, aye. DeSaulnier? Aye. DeSaulnier, aye. Woke. Woke, aye. Got 10.
That has 10 votes. File item 14. Next.
Assembly Bill 599 by Assemblymember Hall, do pass, the motion do pass to public safety, amend in public safety. Senator Alquist.
Aye.
Alquist, aye. Onnested.
Aye.
Onnested, aye. Cedillo.
Aye.
Cedillo, aye. DeSaulnier.
Aye.
DeSaulnier, aye. Maldonado.
Aye.
Maldonado, aye. Pavley. Woke.
Aye.
Woke, aye. That's got 10 votes.
That has 10 votes. File item 15.
Assembly
Next.
Bill 657 by Assemblymember Hernandez. Do pass to appropriations. Senator Alquist.
Aye.
Alquist, aye. Onnested. Onnested, no. Cedillo. Mileno. Pavley.
Sure.
The Hernandez bill,
6-1 right now.
Email saying he would be taking the amendments. Have you heard what amendments he's referring to?
In appropriations.
Mine was on the.
Certainly. We'll have Peter speak to it.
I believe he committed to consider an amendment in appropriations to add a private school representative to the commission, or task force, rather. It was not actually taken.
No, I know it
here.
wasn't taken. I'm just talking about an email that I got. Does anyone like to confirm that or not?
Commitment to consider an amendment in appropriations.
So it's only a commitment to consider if that affects your vote.
And what is the vote?
6-1.
Okay. Thank you.
And Senator Woke. Woke, aye. So it's 7.
So that bill has 7 votes. That was file item 15. File item 16.
Assembly Bill 710 by Assemblymember Yamada. Do pass as amended to appropriations is the motion.
One other question. Is the roll call?
No,
I'll count when you come back.
I'm coming back one more time. I said I would about 4:40, and it'd be more like 4:45 or.
That is commitment
Yes.
in writing, Mr. Cox.
Okay.
You and I can.
On the motion, do pass as amended to appropriations with the chair voting aye. Senator Onnested.
16-7-10.
Yamada, Onnested, aye. Cedillo.
Aye.
Cedillo, aye. DeSaulnier.
Aye.
DeSaulnier, aye. Maldonado. Maldonado, aye. Woke.
Aye.
Woke, aye. That has 11.
That bill has 11 votes. File item 17, please.
Assembly Bill 730 by Assemblymember De La Torre. On the motion, do pass to judiciary, amend in judiciary, the chair voting aye. Senator Onnested? No. Onnested, no. Cedillo?
Aye.
Cedillo, aye. DeSaulnier?
Aye.
DeSaulnier, aye. Leno? Maldonado? Aye. Maldonado, aye. Woke? Aye. Woke, aye. It's got 7 votes.
That bill has 7 votes. File item 18, please.
Assembly Bill 773 by Assemblymember Liu. On the motion, do pass to appropriations. Senator Alquist?
Aye.
Alquist, aye. Onnested? No. Onnested, no. Cedillo? DeSaulnier?
Aye.
DeSaulnier, aye. Woke? Aye. Woke, aye. Cedillo, aye.
And Abel.
And Maldonado?
Aye.
Aye. Oh, he was part. It's got 8.
That bill has 8 votes. File item 19, please.
Assembly Bill 818 by Assemblymember Hernandez. On the motion, do pass as amended to appropriations. Senator Alquist?
Aye.
Alquist, aye. Onnested? No. Onnested, no. Cedillo? DeSaulnier?
Aye.
DeSaulnier, aye. Leno? Negrete McLeod? Aye. Negrete McLeod, aye. Woke? Aye. Woke, aye. Cedillo, aye. That's 9.
That has 9 votes. The next 2 items were on consent, so we go to file item 22, please.
Assembly Bill 1100 by Assemblymember Duval. On the motion, do pass to the Environmental Quality Committee. The chair voting aye. Senator Cedillo? Cedillo, aye. DeSaulnier?
Aye.
DeSaulnier, aye. Leno? Maldonado? Aye. Maldonado, aye. Pavley?
Aye.
Pavley, aye. Woke?
Aye. Oh, the Duval one.
Yes.
Woke, aye. It's got 10 ayes.
That has 10 votes. File item 23, please.
Assembly Bill 1269 by Assemblymember Brownlee. On the motion, do pass to appropriations, and the chair voting aye. Senator Leno? Pavley?
Sorry.
Assembly Bill 1269 by Assemblymember Brownlee.
Oh, Pavley, aye.
Pavley, aye. It's got 7.
That has 7 votes. File item 24, please.
Madam Chair?
Madam Chair. Yes.
Just briefly, I'm going to be voting yes on this today, but I did have some late concerns brought that I want to consider before I vote on it again.
File item 23?
On 24, actually.
On 24. So
Are we on 24 or 23?
We're starting on 24.
we are just now starting on 24.
Okay. So
you're just...
this applies to the Jones bill?
Yes.
And I just wanted to make that for the record.
That is
That I
fine.
would be aye now, but I have some concerns that were brought to me late that I'd like to consider, so.
I'm sure he'll appreciate understanding that. And did anyone else have and I know Senator Wilk was chairing Rev and Tax.
Yes.
When we discussed this bill.
We did. I felt that the bill, I asked that this bill be referred to my committee as well, since I believe it falls into the jurisdiction of my committee. But I do understand that the bill is frankly maybe part of a larger budget solution, and it wouldn't be expeditious for me to do that. So I will be voting aye.
Thank you. All right, we're on file item 20. We're on file item 24.
Several of my hospitals have expressed some concern for a total solution, so they know who the winners and the losers
Yes.
are and how this is
Yes,
distributed. But it seems to be that there's some relevance to going ahead with this part.
I think you...
To make sure that the federal monies, if available, are in play.
Yes, and certainly that's why I was supportive. Thank you. So, okay, file item 24.
Assembly Bill 1383 by Assemblymember Jones, due pass to appropriations. Senator Strickland? Oh, I'm sorry. The chair voting aye. Senator Strickland? DeSaulnier? Aye. DeSaulnier, aye. Leno?
Aye.
Leno, aye. Maldonado? Pavley? Pavley, aye. Woke? Woke, aye. It's got 6 votes.
That bill has 6 votes. File item 25, please.
Maldonado, aye.
So that bill has 7 votes. Thank you. File item 25.
Assembly Bill 1397 by Assemblymember Hill. On the motion, due pass as amended to appropriations. Senator Alquist.
Aye.
Alquist, aye. Cedillo? Aye. Cedillo, aye. DeSaulnier?
Aye.
DeSaulnier, aye. Leno?
Aye.
Leno, aye. Maldonado? Woke? Woke, aye. Maldonado, aye. That's 11.
That bill has 11 votes. Thank you. File item 26.
Assembly Bill 1445 by Assemblymember Chesbro. On the motion, due pass to appropriations. The chair voting aye. Senator Onnested? Aye. Onnested, aye. Cedillo? Aye. Cedillo, aye. DeSaulnier? Aye. DeSaulnier, aye. Maldonado? Negretti McLeod? Woke? Woke, aye. Maldonado, aye. It's got 10 ayes.
That bill has 10 votes. Thank you. File item 27, please.
Assembly Bill 1457 by Assemblymember Davis. On the motion, due pass as amended. Senator Onnested? I'm sorry, the chair voting aye. Senator Onnested? Aye. Onnested, aye. Cedillo? Aye. Cedillo, aye. DeSaulnier? Aye. DeSaulnier, aye. Maldonado? Aye. Maldonado, aye. Woke? Aye. Woke, aye. That is 11.
That bill has 11 votes. Thank you. File item 28, please.
Assembly Bill 1512 by Assemblymember Liu. On the motion, due pass as amended to appropriations. Senator Alquist?
Aye.
Alquist, aye. Strickland? Onnested? Onnested, aye. Cedillo? Cox? Woke? Woke, aye.
Thank you.
It's got 8 aye votes.
That has 8 aye votes. Thank you. File item 29.
Assemblymember 1521 by Assemblymember Jones. On the motion, due pass as amended to appropriations. Senator Alquist?
Aye.
Alquist, aye. DeSaulnier? Aye. DeSaulnier, aye. Leno?
Aye.
Leno, aye. Maldonado? Maldonado, aye. Pavley? Pavley, aye. Woke? Woke, aye.
Have we done consent for everybody who came in late?
That bill has 8 votes. 8 ayes.
Everybody's voted. She should go through and see, is there anything anybody has
Wait.
not?
Okay, so that was file item 29.
29,
We're on file item 30, members. We're almost done.
Assembly Bill 1540 by the Assembly Health Committee. On the motion, due pass to Environmental Quality Committee. Senator Alquist?
Aye.
Alquist, aye. Cox? DeSaulnier?
Aye.
DeSaulnier, aye. Leno?
Aye.
Leno, aye. Maldonado? Maldonado, aye. Pavley? Pavley, aye. Woke? Woke, aye. Okay, it's got 10 votes on it.
Okay, thank you. That has 10 votes. Is there anyone who did not have a chance to vote on the consent calendar? Everybody has been here. Well, thank you, and I know we will go back one more time. Senator Leno has a few more. So we will go back on. Okay.
I didn't say to pass. No, I didn't.
Okay, so we have Senator Leno, we have some, and then Senator Pavlik, who has missed one.
Okay.
Kind of figure out it's just the two.
Okay, just the ones that they haven't voted on. Okay. Item number 2, Assembly Bill 2. On the motion, due pass to judiciary, amend in judiciary. Assembly Member Onnested. Leno.
Aye.
Leno, aye. 2, 3, 4, 5. It's got 6 to 4. Oh, Assembly Bill 2. Yeah, no, the first one was a consent bill.
Okay, now we need to go through all of them and say which one's out, which is not out.
Okay, do you want me to read off the consent as we get to consent, or ahead of time?
Consent we've already done, so just go through everything else.
Okay.
Because there's some people who haven't voted, and then I will say it's either out or ask for reconsideration.
Oh, okay. So Assembly Bill, item number 1 is a consent bill.
Okay.
Item 2
So item 1 was on consent.
is out on a vote of 6 to 4.
Item 2, which is AB 2, is out on a vote of 6 to 4. Okay?
Item 3 is a consent bill.
Item 3 was consent.
Item 4, Leno hasn't voted.
Item 4, please, call for the vote.
Senator Leno?
Aye.
Leno, aye. Out on a vote of 7 to 4.
That bill is out on a vote of 7 to 4. Item 5, please.
That,
I voted on that.
right, it's 10 to 1.
The vote.
Out on a vote.
Okay, item 5, which is AB 217, is out on a vote of
Sorry, 10 to 1.
10 to 1. Thank you. File item 6.
Senator
And
Leno
this-
needs to vote on this one.
Okay.
AB 221, Senator Leno?
Aye.
Leno, aye. It's 10 to 1.
That bill is out on a vote of 10 to 1. Thank you.
Item 7
File item 7.
is out on a vote of 11 to 0.
File item 7 is out on a vote of 11 to 0. File item 8, please.
Same thing. 11 to 0.
File item 8 is out on a vote of 11 to 0. File item 9
Same thing.
is out. File item 9 is out on a vote of 11 to 0. File item 10.
Same thing.
File item 10 is out on a vote of 11 to 0. File item 11.
To vote.
Yes, he needs to vote. Senator Leno?
Aye.
Leno, aye. That's 10 to 1.
That bill is out on a vote of 10 to 1. File item 12.
Everyone voted except Senator Wilk. So it's out on 9 to 0.
Okay, so AB 523 is out on a vote of
9 to 0.
9 to 0. File item 13, please.
Everyone's voted. It's 10 to 1.
That was out on a vote of 10 to 1. File item 14, please.
Senator Pavley?
This is AB 599.
10 to 0.
That bill is out on a vote of 10 to 0. File item 15.
I have to vote.
Yes. AB 657, Senator Cedillo? Leno?
Aye.
Leno, Cedillo, aye. Leno, aye. Pavley? Aye. Pavley, aye. It's 10 to 1.
That bill is out on a vote of 10 to 1. File item 16, please. AB 710.
It's out on a vote of 11 to 0.
Out on a vote of 11 to 0. File item 17, please.
AB 730, Senator Leno?
Aye. Aye.
Leno, aye. 8 to 3.
That bill is out on a vote of 8 to 3. File item 18, please.
8 to 3.
That bill is out on a vote of 8 to 3. File item 19, please.
AB 818, Senator Leno?
Aye.
Leno, aye. 10 to 1.
That bill is out on a vote of 10 to 1. File item 20 and 21, we're on consent. So file item 22, please.
AB 1100, Senator Leno?
Aye.
Leno, aye.
Oh, I'm sorry. I'm a no on that.
Aye to no.
Sorry.
That's 10 to 1.
That vote is 10 to 1. File item 23, please.
AB 1269, Senator Leno?
Aye.
Leno, aye. 8 to 3.
That bill is out on a vote of 8 to 3. File item 24.
Seven to 3.
File item 24, the vote is
7 to 3.
7 to 3. File item 25,
Is 11 to 0.
11 to 0. File item 26,
10 to 0.
10 to 0. File item 27,
11 to 0.
11 to 0. File item 28,
AB 1512, Senator Cedillo. Cedillo, I. Cox. It's not 9 to 0.
9 to 0. That is out. File item 29,
8 to 3. Oh, you already voted on that one. 8 to 3.
that bill is out, 8 to 3. File item 30,
10 to 0.
10 to 0. That is out. And the last item, file item 31, was on consent. Well, thank you. Wait.
On which one? Yeah, we voted. We did.
Yes.
Yeah.
Yes. So we've done them all, yes.
Yes,
Yes.
we have.
Thank you.
Thank you for
Thank you,
waiting.
members. You're welcome.
This consent list was all messed up. The numbers don't correspond with the authors.
I didn't think that one got passed out because I
Oh, is it-